To the Monday morning workshop for BOCC. We have Emerald City on tap right off the bat. There's a couple microphones there if that's what you want to use. Kelly, you make sure the green lights are on.
Good morning, commissioners and community members. My name is Michael Clark, and I serve as the Chief Operating Officer for Emerald City Behavioral Health. Today's presentation is about partnership, specifically a partnership that will strengthen your therapeutic court system, decrease homelessness and overdose, decrease emergency room crowding and crisis, and do so without creating new tax burdens for the residents of Cowlitz County. We're here to demonstrate a sustainable Medicaid-funded model that protects services, improves accountability, and builds a healthier, safer community here in Longview. So a little bit about Emerald City Behavioral Health. It was co-founded by Claudia Johnson. She is my business partner, a psychiatric nurse by trade, and myself. And we envisioned an agency where high-quality, cost-effective care for individuals living with severe mental illness and co-occurring substance use disorders could take place. We currently operate 2 outpatient clinics, one in Tacoma and one in Spokane, and manage 3 intensive residential IRT teams serving Pierce, King, and Spokane counties. Construction is underway on Emerald City Intensive Behavioral Health Treatment Facility in Tacoma, opening next year, which will expand our capacity for high acuity adults needing coordinated psychiatric and substance use treatment. We also own and operate Emerald City Enhanced Services, and that's an enhanced service facility, so a step down from a psychiatric hospital. This is where folks who have been hospitalized, they're able to, it's an unlocked facility where there's a little bit extra care than independent living. So they have access to nurses and treatment and things like that. Across all our programs, we work at the intersection of treatment and accountability. Many of our patients are court involved under the Involuntary Treatment Act, requiring least restrictive alternative monitorings through their respective courts. This blend of clinical expertise, justice system experience, and operational depth is what allows Emerald City Behavioral Health to bring sustainable, Medicaid-funded solutions to counties ready to modernize their system of care. A little bit about me. As I mentioned, I'm the COO of Emerald City and I co-own the organization. I hold a master's degree in counseling, a master's degree in leadership. I'm licensed as an SUD professional, a mental health counselor, and much of my work has been focused around system reform, policy reform, and finding ways to strengthen Medicaid's role in behavioral health and building bridges between the Washington HCA, the DOH, and local providers. My aim has always been to create sustainable programs that blend accountability with access to care without increasing cost. So I began my career and my formal training with Thurston County's DUI drug court program. It's where I received most of my clinical training. That courtroom really was my classroom. It's where I learned what true integration between treatment and justice can look like. Working alongside judges, prosecutors, treatment teams, I realized that something simple but life-changing, and that's judges don't put people in prison people put themselves in prisons, both physically and mentally. And when we can break through one of those prisons, the chances of breaking through the other becomes much greater. That belief that accountability and treatment go hand in hand has guided every step of my work since. I don't know. Yeah, the video won't work. So there's a video here, but because it's in PDF, I don't believe we're going to be able to look at it. So the video just displays kind of a reflection of what's been happening here in Cowlitz County. Recently in the news, the Longview Daily, there was an article on the front page regarding the cut in taxes and that people voted no when it came to behavioral health, that the community is tired of paying for more and more services and not seeing more and more results. And that's what this short video would have displayed. So in our neighborhoods, we see families caught in cycles of crisis. Homelessness continues to rise, people with untreated mental illness. They're showing up in emergency rooms. Our jails are overcrowded, and the courts instead are taking them in and providing care. The same names move through different systems without ever finding stability. So since the behavioral health sales tax expired, those gaps have become even more visible. Voters said no to new taxes, and I respect that. That vote didn't say we don't care, it said we want something that works. The truth is, we all want the same thing. A community where accountability and recovery coexist, where public safety and public health reinforce each other, and Emerald City Behavioral Health is here to help build that bridge. Our role is to take what's already working in your therapeutic court and make it sustainable, measurable, and lasting. Because when treatment succeeds, the court succeeds, and the community succeeds together. When we look closely at the numbers and the stories behind the reality of what's happening with mental illness and substance use, a clear picture emerges. The programs that this county once supported through behavioral health sales tax are now reaching the end of their funding cycle. And many of those dollars kept clinicians in the courts, treatment staffs in jails, and coordination teams in place for some of our most vulnerable residents. Since that revenue expired, overdose and homelessness have continued to rise, and the burden has shifted almost entirely to law enforcement, the courts, emergency medical services, and in many ways, the justice system has become the default behavioral health provider, and that's really not its intended purpose. So currently, your therapeutic court programs are doing what they can, but they're operating in isolation. Without the sustained funding or unified clinical structure they need, the lack of continuity is what keeps people cycling through the system. And we see people recidivism just continues. What Cowlitz County, I believe, needs is a partner that can take those same services, stabilize them, and then make them last without costing you more money to do it. A provider that can meet every state requirement, track outcomes, and bill Medicaid so that the county can step out of the role of direct funder and back into its rightful role as leader and overseer. That's what Emerald City Behavioral Health does best. We know how to carry the clinical load while giving the county transparent data and measurable results. So here's what the solution that I'm proposing today really looks like in practice. Emerald City Behavioral Health will serve as the county's therapeutic court treatment provider. We will hire and supervise the clinicians, deliver all behavioral health and case management services, and bill Medicaid directly, not using your county funds for the work that's being done. That single change shifts these critical programs from a temporary, locally funded model to a permanent, state-funded one. Your therapeutic court programs stay operational, your clinicians stay in place, but the fiscal burden moves off the county's books. This partnership is already proven in all other counties. It's compliant with every Washington Healthcare Authority and DOH requirement. And it gives Cowlitz County something it hasn't had before: one accountable provider responsible for performance, documentation, and outcomes reporting. In short, this isn't a pilot project. It's a sustainable framework that lets the court focus on justice while we focus on treatment. And both sides measure success with the same data. So how it works: the model is really simple. It's efficient. It's used all across the country. Best practices for therapeutic courts. It starts in the courtroom. When a participant enters therapeutic court program, the court makes the referral directly to Emerald City. Our clinicians then step in as the treatment arm of the system, providing the therapy, case management, peer support, and coordination with probation officers and the courts. Every service is billed to Medicaid and not to the county. Those treatment encounters are documented and reported back to the court, giving judges and coordinators a real-time picture of each participant's progress: attendance, compliance, treatment milestones, and setbacks. At the same time, we provide aggregate outcome reports to the county so you can track the bigger picture: reduction in arrests, treatment completions, and successful program discharges. In other words, it's a closed loop system. The court refers, we treat, Medicaid funds, the results come back to you. That's the accountability structure this community should have. So when this partnership takes hold, the results will be visible, both inside the courtroom and out in the community. Each participant in a therapeutic court program will have the same consistent care team from start to finish. That continuity is what keeps people in treatment, improves compliance, and reduces rearrest rates. As outcomes improve, jail utilization drops, and emergency rooms see fewer behavioral health crises. The same clinicians who track a participant's progress also coordinate their step-down plan: housing, medication, employment, continued therapy, so that the work of the court doesn't end at sentencing, it extends into real stability. Local jobs that were once dependent on temporary county funding stay intact, but they're now sustained through Medicaid reimbursement. That means the county saves money while the workforce remains strong. These are the kinds of results that the public can see: fewer repeat offenses, fewer people lost to overdose or homelessness, and more residents returning to their families and contributing to the community again. This is what it looks like when accountability and treatment operate under one roof. So over the last several weeks, your local media outlets, including the Longview Daily News and the Longview Watchdog, they've covered Emerald City Behavioral Health's ongoing work in Cowlitz County. One recent article quoted leadership from CORE expressing concerns that new inpatient services would flood our streets with homeless people. Let me be absolutely clear. That is not what we do. That's not what we would ever want. And that would not be the result of what we're trying to do. Emerald City Behavioral Health provides evidence-based, medically integrated care for individuals with mental health and SUD disorders. We are in network with all managed care organizations and most commercial payers because behavioral health affects everybody, not just those who are unhoused. Depression, anxiety, trauma, addiction, these issues cross every demographic, every income level, and every zip code. What we're building here is not a place that picks people up off the streets. We are building a place where people in your community can go when they need help, a place where they are met with dignity, respect, and clinical excellence. Our census will always reflect the actual needs of this community that we serve. We do not import patients from other regions, and we will never expand beyond what this county can sustain. Every program that we operate across the state is right-sized, data-driven, and designed to meet the standards of both the Healthcare Authority and the DOH. And with that, we also believe that every community deserves access to a full continuum of care, from outpatient therapy and medication management to residential and reentry support, so that people can and have the ability to heal close to home instead of being sent away for services. I also want to clarify that Emerald City has no involvement with the Charlie's building. That project belongs to Emerald City Development Fund. It's a separate organization. Our work here is focused entirely on our current facilities and our ongoing partnership with this county. My investors stand behind this mission because they believe in outcomes, not optics. They believe that when you build trust, operate transparently, and deliver results, communities can thrive. We're not here for politics. We're here to rebuild faith in the behavioral health system by providing high-quality care that actually works for your community. People don't need just any more programs. They need programs that really work. So, the path forward today with Emerald City Behavioral Health in Cowlitz County, and I'm certain that there'll be questions, but what this path forward would look like starts with your therapeutic courts. They're the front door to recovery for many residents, but that door needs to lead somewhere steady. Emerald City Behavioral Health is ready to be a steady place in the community. We bring mental health care, the substance use treatment, psychiatry, peer support, case management, all together in one coordinated system under one roof, at no cost to the county and fully funded through Medicaid for those services. This partnership would give the courts a single clinical team, one set of outcomes, and the reliability they've been lacking. It builds a foundation for something larger, full continuum of care that expands responsibly into youth, family, and community-based programs as we would grow in your community. So what I'm asking for today is straightforward. A resolution of support confirming that Emerald City Behavioral Health will serve as this county's therapeutic court treatment provider. And with that, I am prepared for questions.
Michael, I have a question for you that this one gets posed to me often. With the program, one of the statements that you made is that we don't go pick people up from other counties and bring them here. Can you explain to the public and to me how it is that you're going to be able to sustain a program and what makes this different from other programs that they've come to Cowlitz County and said, based on your population, we can't, it's not sustainable for us to come here. It's not profitable. And one of the concerns is that in order to stay profitable and to have longevity, you would have to bring people in from surrounding areas. Can you speak to that?
Yeah, so we specialize in wraparound care. And so what that means what that means for programs like these ones means that I could not take the same treatment agency from King County and I wouldn't place that facility in Cowlitz. Different demographics. There's, King County obviously has a lot more people. There would be a lot more clients, obviously. So what we would do is we look at the demographics here, and then we understand, okay, so there's roughly X amount of people that might benefit from SUD inpatient treatment. So we might open a 15-bed male and a 15-bed female unit, and that might sustain your county. And then through that, we would look at the model to make sure that we could sustain it through the profits that would net from that model.
Is there anything preventing people from other counties to come to this facility?
Typically, when I meet with boards like your own, there's a commitment from us to you where we agree that, 90% of the beds, say that it's an inpatient center with, we'll just say 20 beds. We'll say that 90% of those beds are always for your county residents.
So like, if Clark County has no facility and they need to transport people to a facility, you would be open to taking them here.
One more time, Commissioner, I'm sorry.
Clark County to the south of us has if they have no facility and they have a need such as what you're providing for Cowlitz County, they would be able to bring people here to this facility. Up to 10% of the beds.
Well, they would, but it's in our practices where we would provide transportation to and from. So if it's Clark County and we're picking up maybe their DUI court or Thurston County, you know, I mean, there's a need everywhere. And so I think that's where these questions really come from, Commissioner, is that everybody wants more access to beds because we know that it's a vital service. And so what's important to know is that we would arrange transportation from where they're at. We would accept that referral. They would come here, complete their treatment, and they would be transported back to, you know, whatever in their aftercare summary, which starts on the first day of their treatment episode. So it wouldn't just be like, okay, you're done, walk out the door. We would ensure that they have somewhere to go day one.
Back to the county they came from.
Correct.
Okay.
Always.
And so if the need was there, you would be looking, and the opportunity was there, be looking to expand as quickly as you could to accommodate large numbers of people. Instead of 15 male and female beds, you maybe be 50 male beds and 15 female beds if the need was there.
So we put people before profits. I believe that profit is the reward of good work. And we also only go where we're welcome. And so I'm not, to answer your question, Commissioner, I wouldn't come here just to expand services to make money. We know there's a need, but there's also a community. And sometimes the community says, no, we're not interested in that. And it's the community's decision.
I wasn't focused on the profits. I was focused on the need. If the need was there, would you expand to fill it?
I would like to say yes, but that's not always the case. Sometimes, like I said, communities sometimes say, we understand the need, but there's too much that comes with the expansion, and that for that reason that they're not interested.
So what you're saying is that if that expansion was a possibility, you would have to work with. So obviously with expansion, that's going to put a strain on our resources, right, locally. So are you saying that if that expansion were a possibility, you would communicate with the local community via their service providers, whoever it is, before you guys did that? You wouldn't just make that decision?
Correct. Yeah, typically, as we've done now in Federal Way, we work with a community type of board that says, you know, this is what we see, this is what we believe. In addition to meeting with city council or the commissioners, we also want to know from the people that are in the community how they feel about that as well.
Can you map out what the therapeutic court program would look like with you guys in charge of it? And what I mean by that is, as far as employees go, because we currently have staff, we have employees that have positions, and we want to make sure that they're taken care of. We also have other service providers. Can you explain what that relationship would look like?
Yeah. So the great thing about this type of setup would be that, you know, if you have, I don't know, if you have case managers, counselors, whoever the county is currently employing, then those folks could easily transition from their current employer, but continue doing that work in a new role under the Emerald City umbrella. I mean, as far as that goes, when it comes to the economy and whatnot, you know, our focus is, as we're a for-profit organization, is generating more taxes for the county, making you guys, you know, more resourceful, bringing in high-paying jobs and those sort of things.
One of the things that in your presentation you talked about for the mental health services, that it would not be a locked door, it'd be an unlocked facility. So how would that work if you brought in people from outside of Cowlitz County and they're in that mental health type of a situation, but they can, at a given time, they can walk out the door and now they're in Cowlitz County
Absolutely. If it's an evaluation and treatment center, whether that be youth or adults, and that expansion occurs and that's the direction that we go, those are 16-bed locked facilities. And so those are going to be your most vulnerable, high risk, high needs patients, Commissioner. And those are the ones that really at risk of, if they had the opportunity to walk out the facility, they very well likely would, because they have been ordered under the Involuntary Treatment Act to be at that facility. So those are lockdown facilities. When it comes to, we'll say SUD inpatient, maybe, those would be unlocked facilities. There's no court order that enforces them to be there. Typically, and under the therapeutic court system, you know, in treatment, we like to say that the gavel is behind treatment, and that can be a motivator. And so if somebody says, I need inpatient, and they're part of your therapeutic court program, then there's a lot of motivation behind that. They want to succeed. They're likely not going to leave inpatient because they know they're going to have to return to the court and report on that. So it really just depends on the facility type. The unlocked facility is an enhanced service facility. That's a step-down facility. And once again, that would be an unlocked. So there's a variety of step-down facility types. It really just depends on the needs of your community.
Michael, what is SUD?
Substance use disorder treatment.
Okay.
Yeah, chemical dependency, addiction counseling. Yeah.
Probably a couple statements, and I have some questions for you. Number one, I'm not totally sure this is even under our purview. We're a judiciary part of the county. We have the responsibility for deciding budgets. I don't know that we have the responsibility for telling them how to spend their budgets. So for us to make a decision for the court, I'm not totally sure we have the ability to do that. So that I'll just put that up front, okay? The other thing I would say is I get that it shifts the cost from the county to the state, but Medicaid is taxpayer funded, so it doesn't really shift any burden off the taxpayer. And I think people, when they don't see it come out of us, they think it's a win. Well, in my world, I don't see it as a win. It's still a burden on the taxpayer, but nonetheless, I just point that out. And to get that reimbursement, I'm sure there's I don't know if they're mandates or whatever rules the state has, you have to comply with those rules to get those, right? So the state's really telling you to some degree how you're going to run your business. I mean, is that fair?
That's fair, yeah.
Yeah, okay. And then a couple questions. How long do you monitor people after the program? Because you talked about fewer repeat arrests, fewer emergency room visits, all that kind of stuff. So when you say that type of stuff, I'm assuming you have data when you've implemented these in other areas that you've followed these people and you've seen these outcomes. I mean,
This was not me reinventing the wheel, Commissioner. The data is actually from the National Association, so it's best practices. So the 5 phases of drug court that are currently best practices as proposed in the plan, it's rigorous, and not everybody makes it through. Not everybody's ready to change. And those people, as you know, if they sign a drug court contract, they forfeit their right to a jury trial, and they will end up going to prison. And when they're released, then, you know, hopefully they'll be ready to change, but that's always an option.
so the data comes from a national organization. It's not anybody following in a county saying, we've seen these results. We're just assuming those results because national data is saying that that's true.
I'm happy to get you the data that you're looking for if you'd like something concrete, and from Washington State. Both Thurston County and Spokane County have great results in their therapeutic court programs, and they use the same model that's presented.
But do you guys as Emerald City, how long do you track people that graduate from the program, or do you track them?
Well, I think that would be up to the county. We offer free counseling to those that graduate ongoing for as long as, you know, once you're an alumni, you have access to our services. It's our you know, congratulations. So it really depends. Sometimes people move away and we wouldn't be able to track them. Oftentimes in counties, we know that the law enforcement, the courts, they're very well aware of the same offenders that are cycling through programs. When they stop seeing those people, we know that there's success there.
Well, we're assuming there's success there, or they died, or they moved out of town, or they did something.
Right. Could be any of those things.
Look, and I'm not opposed if you work with the courts and they want to do this. I'm just telling you, I'm not sure I have the ability to sit here and tell the courts that they need to work with you.
Fair.
Is there anybody from the court that knows what that would look like?
Judge Hahn, presiding court, Superior Court. So in regard to your question, it's a court program. So yes, we would have to go through it and approve it. From everything that I know, I can't say I've individually looked at the statute, but that's my understanding. Certainly has fallen under the courts.
Yeah,
So
okay,
any other questions, or can I ask some questions?
go right ahead.
So you've said a lot of things such as what was being talked about as far as how your agency has done. Do you have any statistics on how your agency has done, not national, your agency?
Yeah, so our specialty is, like I said, the wraparound model. So we're a designated IRT, intensive residential treatment provider. So that means that everything that we do is, one, it's co-occurring, which is rare and it's expensive, but it's worth it. And then all of our patients are probably the most vulnerable across the entire state. So schizophrenia with co-occurring substance use and biophysical concerns are our patients. Most of them are under the Involuntary Treatment Act, so they're under the least restrictive alternatives, Your Honor. And we have seen major successes, I think, at each one of our facilities with a decline of hospitalizations, returning to the court, and then, of course, death. And I would be happy to provide you with that data.
So you're talking about the mental health side of things, not the drug court or any of that? Because what I'm talking about, okay. All right, in regard to, I'll go ahead and ask a couple of questions that I had in regard to the court part of this. In regard to drug court, we also have drug court, Hope Court, we have ITC court, we have ITC for juveniles, and we have drug court for juveniles. Are you telling me that you address all of those, including the juvenile ones?
I am prepared to create a campus-style behavioral health therapeutic core outpatient center for your court that will be fully under the court's jurisdiction, and that's all they will do, is work for your therapeutic court systems.
So that didn't answer my question. My question was, do you provide for juveniles?
So short answer, yes. Long answer, not yet.
So do you know when you anticipate that you would provide for juveniles?
We are launching the state's first IMD waived facility. I'm working with the healthcare authority currently in King County. And off of that, we're hiring the best professionals we can to build the wraparound model we have for adults with co-occurring disorders for the youth. Before I get into any type of program, I want to make sure we can sustain it, and I want to make sure that it's going to deliver real results.
So you talk about your results. Have you done any reports or studies that compare your results to any of the other providers here in Cowlitz County?
Specifically with therapeutic courts?
Any of it?
Cowlitz County has been a little bit more difficult for me to track down because it's fragmented service providers currently with more choice than other counties. So I would say no.
Okay. So, I would look for, obviously, that you would present to the judges if in fact you have the intent of providing drug court as a part of this, because I'm hearing you have your mental health treatment and then you have your drug court part, correct? So two parts?
Correct, yeah.
Okay. So in regard to, let's say that you have conflicts in regard to maybe the dealer and people that have been buying from that dealer. If they're all under yours, how do you separate out those individuals so we don't have an issue?
I think that's common in drug court. In all the years that I worked for drug court in Thurston County, that was a common thing. I think internally that we just ensure that, whether it's AM or PM groups and counseling, that we shift those around whenever there's a conflict of interest like that.
So if you have a domestic violence matter and they come upon each other and they have to deal with their issues as far as, right now we deal with it by going to different treatment providers. How do you wall off those, AM, PM beyond that?
Well, I think the facility would be large enough where, one, there could be the separation. Everything is usually gender specific with all of our programming. And so for that reason, not to say it couldn't be same sex as well, domestic violence, that's a possibility that we'd look at. So I think the only way I can answer that is to say case by case, is that we would look at what that would look like.
So you're talking about a fairly large facility then. Where is it that you're looking to place such, and how long of time are you talking about?
Well, it would be a significant period. Currently, I can't disclose all the details. This hearing is part of the bigger picture here of whether or not we're going to be able to come here, really. But unfortunately, the seller that I'm actively pursuing the property of has enforced an NDA, and so that kind of ties my hands. Which is not I just want to say, usually I'm very transparent and I would just tell you exactly, but I can't.
So one of my issues and one of the things that we've seen has to do with the placement of your facility in relation to where the people are that you're providing services to. Okay, so it sounds like I won't get an answer on that one. So what I would like to see are numbers. You said a lot of things, but there are a lot of things that are very broad. And I'd be interested in seeing the numbers that back up the statements that you've made.
Absolutely.
Okay,
Yeah,
all right.
Michael, I read somewhere that you guys were working on
Your Honor.
a youth facility that was a first of its kind. Is that the one you're talking about in King City or in King County, or was there one in Lakewood or somewhere else that I read about?
No, that one's in Federal Way.
But what is that?
So that will be a 94-bed full continuum youth center that will have everything from family counseling, outpatient services, a 10-bed detox unit, male and female, psychiatric, long-term and short-term treatment.
And is that one of the things that you're planning on bringing here?
Oh, I
That
would
type of
love to.
is that included in what you're working on currently in the mix?
Yeah, absolutely. I mean, there's such a need. Currently, we have 15,000 children under DSHS foster care that are on a waiting list for psychiatric care. So there's a great need for it. Under the current state's budget, each bed that we certify has to be registered as Commissioner Dahl had said, it does go through the state. And so each bed needs to be certified and added to the budget so that it's covered for costs under Medicaid. In your guys's area, in your location here in Cowlitz County, there's definitely a need, and I'm confident that Medicaid and the healthcare authority would allow that into the budget.
15,000 in the state? divided by 39 counties is roughly 400 kids per county.
And that's likely underreported. That actually came from coordinated care and DCYF. That's not my own numbers
15,000,
that are in foster care, yeah.
but in need of psychiatric help.
We don't like to think that, especially when it comes to children, that our neighbor next door is a child that is, showing signs of ODD and is punching walls and, damaging their house, telling parents things that children shouldn't say. But the reality is that these are things that are happening every day in our neighborhoods, especially with children, and that parents desperately want services for their children. It's a hard population. And there's a lot that goes into it. It's taken me just to get 16 beds in Federal Way a year, just to get to the point where I'm still 7 months away from opening. So it's tedious work, but there's a need.
Dallas, go ahead.
Good afternoon, Commissioners. Dallas Steel Grange, Program Manager for Therapeutic Courts. I just wanted to come and get on the record and say that the funds that we receive for drug court, none of that goes back to paying for treatment for the clients that are active in drug court. Those funds are for the case managers, emergency housing funds it's to pay for the functioning of the program to keep the separation between treatment and the court system. None of the money that we receive for funding goes to pay for treatment. I just wanted to make that clear.
Wait, can you explain? You made it clear, but I'm trying to make sense of that.
Well, during the presentation, there was a statement made for the tax dollars paying for treatment costs. That is not the case. So the money that we receive from the taxpayers to fund the program does not pay for their treatment. That's completely separate. That's from Medicaid. That's Medicaid dollars. So there's the separation of the two.
So the mental health tax went to fund what specifically?
The mental health tax, it funded the Superior Court programs.
Okay.
It also then funded the behavioral health, Sheriff's Behavioral Health Unit, and then all the other things that it funded.
Everything but treatment.
Huh?
Everything but treatment then.
Yes, it was not to fund treatment services. Those are billable encounters through treatment agencies. And that's something that the Therapeutic Court program does not do. We're not a behavioral health unit, so we cannot bill for the services rendered. We are strictly case managers. We walk them through from the start of the program to the end of the program. And now, even with our alumni group, it's going after the program. So we just recently, in the last year, built and started an alumni program, so it's going to be more longer term. It's just not, they're going to be out of the system, but they're still going to be, if they want to, participating with our alumni.
So am I to understand that, Michael, according to that, we will still have the burden of funding the programs. You will take on the burden of funding the treatment.
Correct. Well, and to Dallas's statement around case managers, case management too can be billed under Medicaid, and having so many case managers, those could be a part of your single programming so that you're not paying for those positions, which is what I was referring to. I didn't get specific, but that would be included in the package from us, is those case manager positions, which it is my understanding for the case managers that those are funded through the mental health tax. Yeah.
Correct.
And those could all be billable hours. That would be funding those positions if included in treatment.
Those would be billable hours if the case manager is removed from court and put at a treatment agency. Because under where they are right now, like I said, we're not a behavioral health unit or agency, so we cannot bill for those services. So those people would then be removed from county employees, placed at an agency to then bill for services.
Which protects their jobs in the event that you find folks decide to eliminate those positions anyways, or run out of money or whatever might happen.
You had something?
Gina James, Health and Human Services, just in relation to that conversation about who's paying for the service and what that looks like. My understanding of your proposal is case management and treatment billable to Medicaid for that program. Is there something in addition to that, or that would make Emerald City different than us doing that with any of our local providers that bill Medicaid?
Yeah, I think, you know, and I'm happy to get the data from other counties and the best practices, but having all of your therapeutic treatment under one roof allows the courts to track data, to have one accountable treatment provider where they know, okay, you go into mental health or SUD or drug court, you report to this building, and then it's always funneled back.
So I guess my question is, what would be different about doing that with Emerald City versus doing that with like one of our local providers?
I don't know. I would have to ask your local providers why they're not here and I am. I don't have an answer for that. I don't know. There might be answers. I mean, sometimes when you look at a model, sometimes it works for one agency and another agency looks at it and think it's the bee's knees. It's the best thing ever. So I don't have an answer for that.
Okay, but as a billable, if it's all billable to Medicaid, hypothetically, any agency who bills Medicaid could do that.
Oh, absolutely.
Yeah.
You know, and then when you look at continuity, one thing where we thrive is that we pay very well. Our benefits are very well. We take care of our employees and they typically stay with us. I mean, since we launched, we've kept the same employees. And we take care of our people when they're taking care of everyone else. And so I'm sure that that adds to our ability to deliver the services.
Okay, thank you.
Yeah.
My name's Steve Martin, retired Superior Court judge. A lot of what I'm hearing kind of takes me back 25 years. We started this. And I want to make a couple of comments and ask a couple of questions. Commissioner Dahl, yes, one of my other hats, I was chair of the Judges Legislative Committee for 12 years. I was very involved in several iterations of the drug court statute. And most of the decisions belong to the court. Obviously, to the extent there's any dollars and cents issue, you gentlemen have to be involved in that. So I'm not quite sure what exactly that decision looks like. There have been comments made that I think need addressed about a new service that can be provided involving follow-up and data. One of the things I was proudest about when we started this program is since day one, we have got the data. We have worked very hard to make sure we got the data. We maintained contract with a professor. Was he out of Atlanta? When we first started?
The professor, I believe so, either that or.
So if you want that data, we can take you way back. There's obviously tons of national data, but we can show you our data. That data shows that throughout the life of the program, we've generally been right at the top in terms of graduation rates, recidivism rates, right at the top of recidivism and at the bottom. So we've got all that. I'm sure, Dallas, if you haven't sent it over 12 times already, you can send it.
Judge, is that based on county or state?
County.
Okay.
State has a lot of that too. Pierce County was the second drug court in the country. So they've been keeping it for even longer than we have. But we've got it back those 25 years. And it's excellent. So I would like to show it to anybody who shows any interest in it.
I'd love to see it.
Pardon?
I would love to see it.
The other thing I wanted to touch base on, I guess I got a question. When you talk about kind of taking over the drug court, basically what you're proposing is replacing the various treatment providers now with your organization.
Correct.
You're not talking about somehow you'll be paying for drug court manager salary.
That in the business plan, Your Honor, that's the one position that would be county funded, correct? Yeah.
If there's a way to fund case managers that takes it out of town, maybe that's something that should be looked at. But obviously that's a discussion that's gonna have to happen over time. It sounds like none of this is in place. Transition plan would probably be fairly complicated. So it would seem to me that if this is gonna go anywhere, it's gonna be over fairly significant period of time. Any questions for me?
Well, kind of a statement, you can tell me if I'm on the right track here, but it seems to me, whatever we do here, the courts, I would look for the courts to come up with a plan how they want to transition, or if they want to transition, and then it would come to us, and I'd say we support that plan or we don't support that thing. But my vision is it kind of starts in the courts. Would that be fair?
That makes sense to me, and I think that's probably what we're required. I'm kind of an interloper here today. I get to do drug court, once every 4 or 5 months, because I cover sometimes when judges aren't available. So that's the extent of my involvement. But I think as I listened, I had more questions than answers. There's a lot that would need to be discussed. I'll volunteer if the judges want me to be part of that conversation. But I think you're exactly. Thank you much.
Thank you.
If I may, I just want to comment that in listening to the presentation, that it's very general statements. When statistics were talked about, they were talked about either national or state statistics. Those are the same statistics that we could look at. It doesn't change anything. When it comes to the providers, to our people that go through drug court or ITC court or whatever it may be, there is not always a fit for that person in one particular type of agency. Having the ability to provide different agencies better serves our community than having one agency that may or may not work. They may be great, they may not be. We don't know. And to say that we're going to commit to this one agency and have these other agencies that we've been working with that we know have worked, it makes no sense to suddenly go to a different agency that ultimately, the statistics, at least what I know, don't make any sense. We heard broad statements today that could be said, but to actually get down to the nitty-gritty, we don't know yet. So that's something definitely the court would want to look at. But as I said, we have a broad court. We serve juveniles, we serve adults. What I'm hearing is there's not a service for the juveniles at this point. So at least from what I'm hearing at this point, it's not a program I would support.
So, Your Honor, can I ask a question? So if I told you yes, you asked about juveniles, and I said, I will go back to the investment team and completely meet your guys' needs, what would that look like?
I can't tell you yet.
So that's
Oh.
why I have these generalized statements and not the hard data, is so that when we have these conversations, I can understand what it is that you guys need to know if I can even offer it.
What I understand is that you were asking for a resolution to support. How do you support general statements without any factual background to support those? And that's what I haven't heard today. And without having you or knowing you or seeing what your work is like, you may be great. I don't know. But to support someone without knowing what they're really like, I can't say, yes, I would support you. I don't know, but I know that I don't want to see one agency have everyone going to them. That idea I do not support, and that's based on what I've seen over the years.
So Judge,
That's fair.
are the courts willing to sit down and have them do more data mining to get us more information to see if we want to move forward or not?
We can always listen. We're never against somebody coming in and making a proposal and talking to us. As is known, I'm done here on the 31st. But I think the idea will be coming through of, they want to hear, and they're going to ask the hard questions and the detailed questions.
Yeah, I think to Judge Warning's comments, I'd have to say I agree with him. I think it's going to be in order to get to a yay or a nay, it's going to take some time to figure out and to go through the process. And that's, hopefully you guys are willing to do that.
Well, Your Honor, I don't envision this becoming a snap your fingers and all the existing agencies don't have business anymore and this agency does. I would imagine that in moving forward, that if they come to Cowlitz County and they open a business and they start to provide services, just like any other business has customers from the court right now, they would have to prove their worth and earn that business and show that they can do what they're saying they can do. I don't envision this being something that we're just going to snap our fingers and shut off one avenue of help for people and provide somebody that we don't know what their background is personally in Cowlitz County. They're going to have to come and prove that, just like any new business would, in my mind.
Yes, thank you.
The infrastructure for what you are bringing up, we're talking about tens, maybe more of millions of dollars. And so regarding the final ask for resolution, of course, there's going to be an ask, Your Honor, and that's because there is a heavy investment on our side that funnels back into your community. So it's really juggling all these pieces and making sure that it's going to be able to be sustained. And when I go to the investment team, that I'm able to back that up, which is why I'm here and I'm specific. I ask for what I asked for. You've asked me now, and now I will go back home and get you more data.
Yeah, you're welcome to speak.
Thank you, Commissioners. My name is Drew McDaniel. I'm the CEO for Columbia Wellness. And I apologize for my late entry. I've been over at Peace Health getting my annual checkup with Dr. Canada. And I guess I'm in pretty decent health. So I've been listening as much as I could. And so I apologize if I ask redundant questions or bring up redundant topics. Columbia Wellness has been in Cowlitz County for a little over 75 years. We're one of the providers here, behavioral health services, the full spectrum. Your organization hasn't even called us, hasn't emailed us, hasn't reached out. I've spoken with CEOs for the other behavioral health agencies. You haven't reached out. I've spoken with Trinidad Medina from Great Rivers BHASO. You haven't reached out. Your commentary to the commissioners that you're here to provide care and treatment focused on the needs of the community. But you haven't reached out. Your comments have been that you're here to serve people. But you haven't reached out to understand our population. Your secondary comments are that you are here to make money. You're a for-profit organization. But you haven't reached out. Can I ask why?
We're not to that point yet. We're just starting the conversations with the community. As was mentioned, to your honor, is that this is a slow process. We're not here to compete, we're here to collaborate. And I appreciate you bringing that up, but this is very, very fresh.
How have you demonstrated collaboration with this community?
It's starting now.
You've been to the commissioners several times.
I've met with the commissioner one time where
Mm.
it was asked to me. I feel less like these are questions and more like I'm being grilled though, sir. What are your,
I can't
what are your
control,
what are your
I
questions?
can't control how you receive a question. I can simply ask the question. This is a small community.
I understand that.
We value communication. We value transparency. You go to the grocery store, you're going to see someone you know. And for an entity to come into our community and say that we're focused on providing for the behavioral health needs of your community, we're focused on helping others, we're focused on making your population a healthier population, but yet you haven't done any kind of hand extension to the community members themselves. Have you held forums in the community to ask people what they need?
We're not there yet.
Not there yet, but you've decided that the need exists
Well, we know the need exists
because you've met with people and asked them?
because there's no service providers that provide some of these specialized treatments that we can develop in your county.
Okay.
Like I said, if your county says we're not interested, okay, cool,
Mhm.
that's fine. I will listen to the county, but we're not there yet. I don't have all of the data.
Okay. Well, maybe I'm old-fashioned, but I think listening to the community members is a good start.
Absolutely.
Yeah. The other question that I have for you is I'm not sure why there wasn't a complete answer to the commissioners about the populations that you would serve. The question that I do recall asking was that if a person were admitted to the facility, could they leave? And you didn't answer that. You jumped to the Involuntary Treatment Act and the evaluations under 7105. But is it not true that if a person comes to your facility on a voluntary basis, they can leave on a voluntary basis?
It depends on the facility. An enhanced service facility, a 16-bed, of course, they can come and go as they please.
They can come and go as they please.
But we haven't presented an ESF here.
Okay.
If it's an evaluation and treatment, whether it's youth or adult, they cannot leave. I haven't presented that either because I don't know if the community would like that. If it's an IB facility, an intensive behavioral health treatment facility, they cannot leave there either, and that's community-based treatment. So it depends on the needs of the community, and we're not there yet.
It depends on the facility which you build. If you build a voluntary facility, persons can leave as they wish.
Voluntary.
Yes. They don't have to get in a vehicle to take them back to the county of origin.
Correct.
They can remain in the community unsupervised.
Correct.
Okay. Just want to provide clarification with that. With the involuntary piece, what work have you done with the courts to discuss the financial burden and the burden on personnel for additional involuntary treatment hearings?
We haven't gotten that far.
Haven't met with the courts.
We can find, we could do this all day and pick apart every problem that poses. And I'm happy to do that. I'm not prepared for that today, but I'm happy to sit down and we can go back and forth. What I'm looking for is just gaining a sense of, does this community want any of these services? If not, then continue doing it as you've done. And that's
Mhm.
respected. But when I'm here, if there's a way to help find solutions,
Mhm.
then I'm happy to be a part of that.
Absolutely, as are the providers and as are members of the community, where a hand reached out to them. The other question that I have for you is, how can you say that you can reserve 80% of the beds for Cowlitz County residents? Your for-profit facility, if you have a bed available, there are standards to take people. How would you turn someone away?
So is the question, how would I turn someone away?
Yeah,
or-
if you have a bed available and Cowlitz County residents have only taken up 70% of the beds, quote, reserved 80%,
Yes.
how would you turn someone away if you have a bed available from another county?
Well, first off, 80% is hypothetical.
Hypothetical,
Yeah.
yes.
And then if it's 70%, so we'll just say there's 2 beds that are still allocated for the county, then those beds will remain ready for the county. Once again,
And you'll deny it admission?
We will have to give a referral, absolutely, but our commitment is to the county that we serve.
Mm-hmm. Okay. If that impacts your profit, would that number change as time progresses?
It doesn't,
It doesn't?
no. I
Okay.
budget at a low conservative number so that when I present
Mhm.
to the powers that be, that it is represented in that situation.
The reason I ask is I've been a DCR for a little over 25 years, and I've worked with Superior Court judges across the state. I've worked with prosecuting and defense attorneys across the state. And I've had the opportunity to write legislation that our governor has signed off on. And I have seen entities that, quote, reserve beds and reserve bed space close their doors because they can't keep their beds filled. And my concern, the main reason I drove from my doctor's appointment to here, is Cowlitz County is where I raised my family. Cowlitz County is where they went to school. Cowlitz County is where I pay my taxes. Cowlitz County is where I invest my time and efforts to help it make it a healthier community. I'm concerned of any organization that simply comes in and says, we've done the research, we've done the legwork, we've done the footwork, but yet no one that I speak with can say you've reached out to them. My concern is that they've asked you direct questions that you didn't give direct answers for. That is a bad start for building trust.
Hmm.
My hope would have been that you would have approached this in a different manner. I'm not opposed to competition. We stand on the quality of work, as do other providers that we give. What I am opposed to is simply coming in and saying you can do things and, in my opinion, not give the full story.
Okay. I appreciate all the back and forth. I need to bring this a little bit back to focus because it was really just about drug court today. And I know they have a much broader thing to go, and I think some of those questions will be answered as they work through the process. And I don't think that'll fall under us because if I understand correctly, you'll be working with the city of Longview and working through that. So I think a lot of those concerns should be addressed. Today, we were just talking about what do we do with drug court if there's an option there. And what I'm hearing, and you, CMAS can correct me if I'm wrong, but I think it needs to be worked with the courts, and if the courts, if they can come up with a plan, then it comes to us is what I'm kind of hearing. Would you disagree with that?
No, I felt like this was just very broad strokes right now,
Hmm.
and I didn't anticipate nickels and dimes answers, right at this point. I appreciate all the discussion that's gone on. But I absolutely agree with Commissioner Dahl.
Who should he contact at the courts?
Okay. Okay, thank you.
Okay. Let me just check, make sure I don't got any hands on the deal. I see none. Okay, I would thank you for your time. Thank you for all the participation, and I think you've heard the direction to go, so we'll go with that. Thank you.
Thank you.
Thank you.
Okay, Kathy. Sorry, Kathy.
That's fine. Okay. We have, one budget workshop, scheduled, and it's for a prosecuting attorney's office, and I'll ask Ryan to come up. And it should be fairly quick.
Did you want to go through the?
So, I put together a fairly easy slideshow just to show you some of the line item budgets for the prosecuting attorney's office and those lines that changed. And so I guess I could turn it over to Ryan. So for example, cell phone charges, he's decreased that by $2,100.
Did you reduce your data usage or what'd you do?
Well, our agency is relatively new to cell phones, meaning this last budget cycle. So we overshot what we anticipated the annual expenses to be. So if you look at the top two lines, which are cell phone charges and dues and subscriptions, those are tied to the civil portion of our budget. And then down below is the criminal. So we have it split up between civil and criminal. So yeah, on cell phone charges, yeah, reduce 1,500 for the upcoming year on civil and 6,000 on criminal. Obviously, from a staffing perspective, we have 3 civil deputies. On the criminal side, we have 12. So yeah, that reduction is purely overshooting it in the last budget cycle. The next line down, I guess dues and subscriptions, we did make a request for about $5,000 in increase. That also is a line item that's split between civil and criminal. What does that entail? That's our Washington State bar dues, our Westlaw, so our case or our research system. Any subscriptions, books. An example of books would be generally the only hard copy books that we get on an annual basis is Teglin's evidence book, which is the primary book to utilize for trial purposes and evidence. So generally with changes, we annually usually get a new one of those for each of our criminal DPAs. Also included in dues and subscriptions, WAPA, so the Washington Association of Prosecuting Attorneys, our dues there, as well as the NDAA, National District Attorneys Association. But primarily what's causing increases is Westlaw, which is our research program, case law research. So moving down to gas, used to be $1,000. We eliminated that. So in the last couple of years, we had leased a vehicle through the county. We turned that back to the county. So now we just pay mileage. So we have no reason for a gas line item. Professional and contract services. We had put in a request for an additional $10,000. What that includes are on court-related matters. So for example, we have to utilize process servers when we can't get the sheriff's office to serve subpoenas, for example. The sheriff's office does most of our serving of subpoenas. So what do I mean by that? So let's say on any given week, we have what's called a readiness calendar. So which is what cases are on the docket to potentially go to trial the next week. On a civil priority week, which is the first full week of the month, it can be one or two. Usually civil trials don't go, but also the courts generally don't schedule criminal trials that first week. So at a readiness calendar, we can have anywhere between 20 and 50 cases on for the following week for trial. Obviously, with our court schedule, judicial availability, you can only generally have 1 to maybe 4 short trials in a given week. Generally, there's 1 or 2. So in the weeks preceding the readiness hearing, we're having to subpoena, or at least strategically anticipate what of our cases we think are going to trial. So subpoena any witnesses in the case, law enforcement, civil witnesses, expert witnesses, et cetera. So we try to rely on the sheriff's office as much as possible, but that doesn't always happen. Also out of that, shredding, certified documentation. So anytime somebody's found guilty, let's say at a trial, we have to prove their criminal history. So unless they agree, we have to get certified judgment sentences for every conviction they've had in the past, as well as transcribing. So those are the types of services underneath those line items. Intergovernmental services. That's a reduction. Looks like 12,500. Meals and lodging. So generally under meals and lodging. So generally speaking, being part of WAPA, WAPA puts on a lot of trainings throughout the year. We have a summer training session, fall training session, specialized training sessions throughout the year. By we, I mean WAPA puts them on. Being a part of WAPA, those don't cost money, but we have to pay for mileage, hotels. Generally speaking, our 2 big trainings in the summer and fall are 3 days. Specialized trainings can be 1 day or even a couple of days. So we have criminal training, civil training, there's sexual assault training, victim witness training, DUI boot camp, district court, juvenile court. So having 18 attorneys, we're not paying for trainings generally. Sometimes we do for specialized training outside of WAPA, but that generally includes obviously hotel rooms and or mileage and or meals when an individual goes to training.
Ryan, are those included in like any ongoing certification or continuing education or anything like that?
Trainings?
Yeah.
So as any attorney in my office is required to get 15 years of continuing legal, 15 hours of continuing legal education every year. So there's a reporting period every 3 years. So they have to report, for example, at the end of this year, I have to report the 45 credits to continue to maintain my license.
And is that on you, or is that included in this that you're talking about, these trainings? Or do we?
So these trainings satisfy those
Okay, that's my question. Okay.
State Bar Association hours. So generally, like let's use our summer training, for example, which is in Chelan. Our fall training usually rotates somewhere between the west side and the east side. So one training, so usually the Chelan bigger training and the fall bigger training cover 15 hours over the course of 2.5 days. Obviously, from a scheduling perspective in our office, we have to figure out, who's going to district court training, juvenile training, criminal training, and kind of schedule it. So we kind of split it up so not everybody's gone. We don't have the ability to shut down the court system for a week like the judges do. So other than some of these obviously reductions and increases, the only other budgetary item that we had discussed was the mental health sales tax dollars and the utilize, how we're going to pay for those. So obviously that was addressed a couple weeks ago. I don't know if you had any questions on that, but part of my proposal, and it sounds like you guys were looking into utilizing investment from the opioid settlement, but part of my proposal was utilizing a portion of my drug fund for a couple years to kind of offset that a bit. It looks like Kathy did put in here about $25,000 a year. As I had previously mentioned, used to be a legal financial obligation based fund. Our courts are no longer imposing legal financial obligations, so this is something that is not continuing to grow other than interest. But I think it was right about $256,000 is where we're at right now.
Yeah, correct. After the 25,000, it'll be about 220. The fund balance will be 220,000 at the end of 2026 is what I project.
Okay.
So go back one slide. I guess I'm surprised some of these categories, several of them are more than a 35% increase from last year to this year. That just seems like a hell of a jump for me. Professionals and contract services, $10,000, that'd be a 33% increase. If I'm doing the math in my head correctly.
Did you say dues and subscriptions? Sorry, is that what you were talking about, or?
No, I was looking at, well, dues and subscription, that's a good example of another one, yes.
Because I thought you had mentioned, yeah.
Professional fees. 10,000.
Dues and subscriptions, professional and contract services, meals and lodging, mileage. Some of them are well over a 30% increase in 1 year. Is that normal from year to year?
I would say no. So for example, obviously cell phones, let's see here. It's usually better to look at criminal, not civil. So it's tough because we're kind of guesstimating like on certain things. For example, professional and contract services, like I had indicated, we're talking about subpoenas, transcribing, certified documents, shredding, any of those types of things. In 23, it looks like the total expenditure was 21,000. Through in 24, it looks like 20. Last year, 30. Through June, we were at 20. I'm not particularly sure where we're at now, but my office manager was out of the office last week due to a private issue. But we're making guesstimations. A lot of things what we are dealing with is, what costs money for us. Trials are a big driving factor there. If you go from late COVID to now, there's a huge difference as to how many cases are going to trial. What costs money in a trial? Well, like I had mentioned, serving subpoenas. Right now, we're in the middle of a second homicide trial, and we had a 2-week homicide trial 3 weeks ago. Right now, we're in week 2 of a second homicide trial. And then starting next week, we have a third homicide trial starting. So the amount of witnesses, for example, whether it's, subpoenas, mileage for services, et cetera. Let's use the medical examiner, for example. He's charging us hundreds of dollars to testify per hour. So have we ever had 3 2-week homicide trials in a row? I purely a guess here, but I'd say that's probably never happened in Cowlitz County. But those are generally the types of things that, fluctuate on an annual basis. We can go a whole year without a homicide trial, and there's gonna be a lot of costs that are much lower. But I believe the 40,000 as opposed to the 30 is an estimation just based upon the fact that things such as, more trials are happening now than 3 years ago, for example. things like that. Expert fees, all that costs money, subpoenas cost money. Obviously now compared to 3 years ago, the courts are much more open. Just things like that. You know, could we potentially stay under the 30,000? Maybe, but we're just kind of guesstimating based upon what we anticipate with the courts much more open up than what they were the last budget cycle. And the fact that we go to trial quite often. Is that a good thing or a bad thing? That depending on perspective, but I think it's a good thing, but it costs money.
Okay, so like dues and subscriptions, I'm hoping that the books you get, you download, so if the internet goes down, you can have still access to them. But dues and subscriptions, I guess is there, what would change that's that big of a jump in 1 year?
Generally, what goes up for us in dues and subscriptions, generally not so much, let's say, the state bar dues or WAPA or NDAA. The subscriptions that usually increase for us, and they probably have the vast majority of the legal system kind of beholden to them, is Westlaw. So your online research systems. I know that's gone up recently. I don't have the exact amount, but that's where all of our research is done through Westlaw, which also includes some books, like I'd mentioned, but nonetheless, I know that's increased lately. I don't know. I don't have the exact number.
Okay, I'm just surprised that the number in 1 year is that big of a jump. But, okay.
So Ryan, I get that you're making guesstimations based on the legal environment that we're currently in the state and in our area. Does the caseload for Ian's office affect you in any way? Is there, you know, how usually there's an equal and opposite reaction to everything? Does it affect you in any way?
I mean, all it means for us is that they have less cases per attorney. You know, a defendant is, you know, entitled to a defense, but society's not entitled to a constitutional prosecution. So I mean, the fact of the matter is we dictate basically how many cases they get, right? Because we're at the front end. So we get a referral from law enforcement. You know, we have a whiteboard with every felony arrest from this weekend or, you know, every day. So, you know, what decisions we make dictates how many cases they get. You know, we get a felony case, we charge it a felony case, they get it. We get a felony case and we're like, oh, there's insufficient evidence to prove value here on a theft. It needs to, you know, it's a theft 3, not a felony theft 2. We either kick it down to our district court, or if it's a city case, we kick it to their municipal prosecutor. So, I mean, we control ultimately their caseload. And on the flip side, that also means that we're reviewing a lot more cases than what they receive. You know, it could be declined, it could be sent to a muni court, it could be whatever it may be. So, I guess the answer to your question is, you know, we control, I guess, the amount of cases that they get. What the reality is going to be for us, though, is less prosecutors dealing with more defense attorneys who have a much lower caseload, and presumably they should be spending a lot more time on each individual case, which includes motion practice, interviewing witnesses, things of that nature. Reality, I'm pessimistic about that, but that's the big push, is they need more time per case, right? Which is a push from Puget Sound, not the rest of the state. So I guess that reduction in caseloads for public defenders should put more burden on my people per case, but we'll see.
They have a few other accounts, but child support was one of their other budgets. And they're actually forecasting a decrease overall in that budget. And they have a slight very slight increase in revenues. I just thought,
And one thing with child support is that we're effectively contracted with the state. So the state reimburses us at is 105 or 106% of what so that department is reimbursed to the county through the state. Now, obviously, all tax dollars are tax dollars, but
Is that increase in revenue an increase in the percentage that's reimbursed back or participants in the program?
I don't think your rate changed, did it?
I don't think so.
No, I don't think their rate changed.
So
So
it's
it's
more
just-
people paying.
Mhm. And I think that's really it. Like he said, there's the drug fund, and really there was very little change on that account, or other than transferring 25,000 each year to help cover prosecuting attorney expenses.
Yeah.
And they also have a prosecuting attorney witness, victim witness, but there was very little, there wasn't any significant changes whatsoever on that budget.
So what's the bottom line total for the budget change year over year? Since I don't see a total at the bottom line of anything.
So victim witness shows, since you just mentioned that, a reduction of about 3,000. Child support from 25 to 26 shows an increase of 2,000. So for our prosecuting attorney general fund, 25 approved was 3.483. And 26 request shows 3.409. So a reduction of 74,000.
And those numbers include all the personnel items in there.
So overall, it's 75 grand reduction.
Well, your note says slight increase in revenue for 2026. It doesn't say a decrease.
Yeah, so that he's just quoting you the expense categories right now. I can get you the actual revenues versus expenses.
Okay.
Ryan, a short crystal ball question for you. Since stupid decisions tend to run in bunches, the one with the OPD with the limits on cases, have you seen anything on your side that anybody's pushing through?
I would make the general statement that the legislature doesn't really care about our side. I can say our state association, Washington Association.
I don't think the other one started with the state, did it? It started with like ACLU filing a suit or something of that nature.
Are we talking caseload standards?
Yeah. For defense.
That actually started with the Washington State Bar Association. They had a think tank group. They came up with their numbers, ultimately went to the state Supreme Court, and then they made their ultimate decision. So the State Bar Association came up with the numbers. The state Supreme Court obviously ultimately adopted those numbers, but they put the 10-year, 10% reduction into it to hopefully, I guess to ease the burden on the local governments, because we all know the state pays very little in criminal justice and public defense in Washington and law enforcement. But on our end, I don't ever see any type of caseload standard that would happen from above. Our association is currently doing a work study. So right now we're in the midst of a 5-week time study on, what do prosecutors spend their time on? Is it, pre-filing, investigation, search warrants, stuff like that, reviewing cases for charging, talking to law enforcement, how much time we're spending in court, writing a brief on a particular motion. For example, my chief criminal deputy And my assistant chief, they did the first murder trial that got done last week that resulted in a murder one conviction. So they did not keep track of any time, but their life's pretty easy when it comes to tracking time because the 2 weeks preceding the trial, they were in the office 13 hours a day. The 2 weeks during the trial, they were in the office 13 hours a day, 7 days a week. So all they have to do for their time study is write John Roach case every day for a month, basically. So yeah, we're right in the process right now of doing an actual case study. The study that was relied upon in those public defender numbers was more of a think tank conversation, like what do we think we should be spending on, a case? So we're actually doing a real study with real time. And so we're in the process of that right now. So I don't foresee it coming out probably until, I guess I don't know how long it'll take them to complete the study, but probably early next year is when we'll have an actual study based upon actual substantive data of actual attorney time being utilized on cases, which is not what the public defense standards study was based
Right.
on.
Would you-
Fortunately, there was a few counties throughout the state that had 6 figures set aside for this, and so so there was a accumulation of money that mostly came from a couple other counties to perform this study. So
Would you share that with us when you get it? I think it'd be interesting
yeah,
to see. Yeah, okay, thank you.
I'm interested to see it too.
Yeah,
So,
any other questions for,
I'm good.
well, you're first on the list for agenda. Yours looks pretty easy. We're just, RCW has changed some numbers, and so we're just changing some numbers to reflect it. Jason's online for that? Sorry.
Can I ask one question while we're still on prosecuting attorney? So when we approved their partial positions in the budget, we said there was enough opioid interest income funds to help cover those partials, but it was really only enough money with OPD and PA's office for 2026. For 2027, not knowing if they're eligible for opioid money, regular settlement money, my plan was to fund 27 off a general fund. Is that appropriate?
What choice do you have?
Yeah, I think,
I don't know if I have a choice, so, I mean, I can research with, Gina and I could probably research if they're eligible for opioid settlement funds, but I was planning on putting them on general fund for 27.
I think, personal opinion, I think you put it in the budget like you're suggesting. If we look at it and have to make adjustments, we would do that, but
Okay, I just wanted to clarify.
yeah.
How much money is it total?
It's a total of 270,000 for public defense and 200, no, not 200, I'm sorry. Hold on, for prosecuting attorney's office, it's about 65,000. So it's a total of 330,000, more or less.
Okay.
Hey, thank you.
sounds like mine's a lot cheaper.
Mhm.
That's what I got out of that.
Okay, Ryan, thank you.
Thank you.
Yeah, thanks.
And you said Jason is online for this other? There he is. Yes, sir. I think this one's pretty easy. They changed code, so we're changing to match it. Is that the simple way to say it?
Yes, as we discussed last time, that's exactly what's happening. And I think the board has reviewed it and think that it's important to do.
Just writing myself a note. Any questions on that? I think that's pretty
I
straightforward.
looked at it, it looked very straightforward to me.
Okay, sir. I appreciate your time. Thank you.
So, yeah, so Kelly, are we on then for tomorrow, correct?
Yes, we have you on the schedule for 9:30.
All right, thank you all.
Thank you.
Thank you.
Thank you.
Kathy, it looks like you're right back.
Okay, Office of Finance, Kathy Funk Baxter. We have one item for the agenda tomorrow, and that is a contract modification addendum amending the contract with City of Longview for their grant related to the Rural Public Facilities Fund. There's no changes to the contract other than they wish to extend the time period to complete their project. And so we want to extend that date for them. So
Sending it out to the end of June.
yes, to June 30th, 2026.
Okay. Have we started on it, or is it just a late start?
I think it was just a late start. They had contracting.
Which is fine. I just
Yeah.
like to be accurate when I tell them what we're doing.
Hi there, how are you doing? So just kind of to give you a background, we had planned on trying to get it done earlier this year. This is a project that was set to get done in 2026.
Yeah.
I got a phone call about application, so we turned in an application. But yeah, we're currently working on it. We're trying to do the engineering and design in-house instead of hiring an engineering firm, which would cost about an additional $100,000 according to the people I've talked with in engineering. And so we just have some other projects, like the Mount Solo Reservoir project with a FEMA grant. That's about a $3 million grant, and our engineering team is just running behind. So that's kind of where we're at. That's why we just want to extend the timeline out to June of 2026.
Yeah.
With these types of funds, Kathy or Chairman, maybe you can educate me. Are we extending the time frame in which we're going to give you the funds, or the time frame in which the project is going to take to get finished, or both?
On this particular project, it's a cost reimbursement project. And so we will not fund it until they ask for a reimbursement. So
And is that with all the rural public facilities funds, or just this particular project?
no, some are cost reimbursement and some are an award up front.
And how do we determine that?
In looking at the project and reviewing what the project entails.
The reason I'm asking is I was at a Kalama council meeting last week, and the money that we gave them for their water tower filter system, that project has been put off because they haven't done what they needed to do to receive the grant for that. So my question is, when we approve those, do we, so obviously they're not, some of them are on cost reimbursement, some of them we
Right.
give it up front.
Right. Some of them, so for example, that's a good example. Some of them, they're asking for the funds because they do have a cost match for another source of their project. And so they want to receive those funds up front in order to qualify for the match. So we look at everything that's in their proposal before we make that decision. And also for a short-term project like this one, cost reimbursement makes sense. So
Do we have a mechanism to go back and say, yes, they've used, whoever we give this money to has
Yes.
used it, or it's still sitting in an account?
no, we have, as part of the contract now, the contracts that we're issuing, we have an exhibit that says that when the project's finished, they have to provide us a certification that all the funds have been used. And so when they do their application, like in this case, they said they thought they would be finished by October, and we had this one, I think, at December, but so we look at when they said they were going to start the project, when they were going to finish the project, and we do follow up to find out how are you doing on your project. And in the case like this one, where they said, okay, we hadn't seen any reimbursements, so we reached out to them and asked them about it, and they said it's been delayed. Can we extend the contract time period? So, yeah, so we're monitoring when the projects are finished and asking them to certify.
So these are funds out of last year's budget.
The funds for this project is 2025.
Okay.
And I think on Kalama, we funded for 2 different project periods.
Yeah. I think Commissioner Raiders, I think where you're going with this, and this doesn't involve the rural development funds, but the city of Woodland for the exit 21, we awarded some ARPA funds for that. And we kept wondering, when are you gonna do this? When are you gonna do this? When are you gonna do this? And it got, I wanna say almost 2 years. And so we were kept up to speed, but at some point in time, we could have made the decision, hey, you're never gonna use these, and bring them back. Does that kind of help a little bit?
Yeah.
Yeah.
Yeah, and in our contracts, we even have a provision there that says if they don't utilize the funds for the project, they have to return them if we paid them out ahead of time. So,
Yeah. Okay. All good. Thank you.
Thank you.
Public Works.
Good morning, Susan Eugenius, County Engineer, and we have about a baker's dozen for you today. Do you want to go in order or switch back and forth?
Let's go right down the numbers.
All right, so number 1 is the call for bids for the Camelot on-site, large on-site septic system replacement. This is replacing the existing system to stay in compliance with permitting. The existing system is no longer functioning properly, so we are replacing this. This is being funded with ARPA dollars. And the engineer's estimate, if I believe, let's see if I can do it off the top of my head, is $650,000 for a replacement.
Did you say 6?
650, yes. And it serves, I wrote it down somewhere, approximately, we currently have 52 connections.
So number 2 is going to be a call for bids for as-needed electrical services at headquarters landfill. Our previous contract expired and we're just getting back out there to do another one. It was a 2-year period for approximately $150,000 was our last one. So we'd expect that to be in a similar range for this next one as well.
Can we go back to number 1?
Sure.
In a situation like this one, I don't know that this applies, but do we have, how far back can we go to go after a contractor who does something like this? Is there a statute of limitations on that? Or I mean,
So this is just a reaching end of life. This is the existing
it's not-
system. No, this has been in there since the 80s when Mount St. Helens blown. So this is just an end of life.
So you expect a septic system to only last 50 years? Or 45?
It depends on the system and the use. So private systems, well-maintained, are not as, I shouldn't say this in public meeting. The permit requirements are different for a private system than a community system and are reviewed more frequently by Department of Health and Ecology when you have a public system such
The
as
system
ours.
we're proposing to put in, you expect it to last how long?
Generally 50.
And so to go back to his question, is there ever a statute of limitations on when it's put in, on how long it's promised to work?
So in some of our construction contracts, I'm obviously more familiar with roads because we do those way more frequently. There is a period of performance, and they, depending on the item, will range 1 to 5 years where you can go back on the contractor, unless you can really prove that there was some negligence put in the project.
Okay, Thank you.
Flip it over, double sided.
So on item number 2, what type of ongoing electrical services do you anticipate for the landfill that we're negotiating or taking bids for?
Sure. So maybe a PLC goes out in the pump house. Those need to be replaced and repaired in a timely manner. Maybe some sort of sensor goes out on the flare system. We'll need that replaced in a timely manner just to keep the systems running. It's really about the response time. Instead of having to go out to bid for each one of these individual smaller projects, having someone available on call that can respond quickly.
So that's what the bid is for, is on-call services,
Yep, as needed.
not for actual cost of the project.
Correct. It's a cap not to exceed. And if we ever get to that point, we'll come back and have another conversation with you guys.
Okay.
And then number 3 looks really similar. This is for Tenant Way, call for bids for electrical and mechanical services. So a little bit different than headquarters, a little bit older equipment there. So more mechanical and electrical in the same nature, but same idea. This one would have a smaller not to exceed of 75,000.
2 years.
All right. Item number 4 is a contract completion letter to Lakeside Industries for the 2025 countywide pavement overlay project. The total project is $2,908,870.72. This is our closeout paperwork after the project's done, revenue, so we can release any retainage that we have and they can let go of their bonds.
Item number 5. Gotta turn it back on. Item number 5 is gonna be a bid award to L Rock Industries for snow sand. This is 750 tons to each shop for a total cost of $62,290.24. Getting ready for the snow to come.
What qualifies as snow sand?
It's a screen sand product to get all the larger materials out. So that way, when it's running through our spreading equipment, we don't have jams or clogs or things of that nature. So, you know, when you get a pile of sand, occasionally have larger debris in it. This has gone through a screen to remove all that debris.
Okay.
Sean's an optimist this year. He says we are not having any snow.
Down to what elevation are we
That's the
protected
question.
there?
That's sea level.
Good luck.
So item number 6 is a supplemental agreement number 1 with OTAC for the Pleasant Hill Road temporary bridge replacement. And this simply extends the expiration date to December 31st, 2027 and updates the rates associated with the contract. The reason we need to extend this is not due to OTAC's work. This has been in a long holding pattern with FEMA going through the environmental process. So when you're doing a project with FEMA, they run a little differently than other funding partners. FEMA actually does your environmental permitting for you. And so they have been taking a longer time on this than we anticipated due to project manager changes, all kinds of different issues. So we're waiting on them to get back with us on our environmental so we can continue moving forward and finalizing the design. All right, item number 7 is the contract and bond in lieu of retainage for with Advanced Excavating Specialists for the emergency contract for the Sweet Birch Drive. We've talked about this one. So that's just the paperwork moving it through.
What was the time frame on that to get that replaced?
So the physical work besides the final site cleanup is complete.
Wow.
So that's why we did it as emergency contract. So they have placed a new line. It's all grouted in, it's backfilled, but they have not finalized the site cleanup.
Good.
So let's see. It was 7. Item number 8 is amendment number 1 to a personal service agreement with Appraisal and Consulting Group for appraisal services to extend the contract till December 31st, 2026. Just another last one lingering. We had most of those come in already.
And then item number 9 is going to be amendment number 1 for the Cook Ferry project. We've talked about this a few times with the extension and the minimum quantity increase on that. And this is the finalization of that agreement.
How many cubic yards total are stored there?
I think in that cell 4, it was about 400,000 cubic yards. Total, I believe, is closer to 2.4 million cubic yards.
So we're just making a dent in it.
We're chipping away.
You know, I see their trucks quite often because I know the way around that, and we haven't had any complaints. It's been pretty quiet there, right? Yeah, because we initially were talking about speed bumps on on the one road, but it looked, it seems pretty low traveled.
Well, yeah, we have not received any
Yeah.
real complaints about that goes down. We had one complaint about speeding that our road operations was talking to people about, but not a lot.
I know their initial time frame was October 9th. Obviously, they're running a little bit behind. Have they reached out or told you any different?
I have heard no updates
Okay.
from them.
All right. Okay.
Okay, so now we take a big leap to items 15. So item 15, A, B, C, and D. So letter A is the recorded possession and use and a right of entry for 141 Birch Street Drive. That it relates back to this emergency storm drain. So we obtained those so we could go in, get the work done. Now that the work is done, we're surveying in the exact location. We will work with the property owner to get a final easement and settle on a price for it. Then items B, C, and D all are related to the Riderwood supplemental water source project. These are 3 different, 2 easements and the property purchase. So there's an easement with R.H. Emerson and an easement with Dennis and Sally Hall for the water lines itself that connect down the existing road into the treatment plant. And then the property was purchased approximately a half acre from R.H. Emerson for the actual site of the reservoir that we're going to construct.
Side question unrelated to this, but related to Riderwood. How are those new meters working out there? Do we know? Have we gotten any feedback?
I haven't heard any feedback lately. Have you any on the new water meters?
I haven't been involved in that project too deeply, but we can get some feedback and come back with our Wednesday on that.
Must be working good.
Yeah. In that situation, I guess no news is good news when we'd hear about it.
Yeah.
That's my grand total unless y'all have other questions.
Okay. Thank you.
Thank you.
Thank you.
Thank you indeed. What a calendar. We're got a lot super busy tomorrow. But
Yeah. Gina.
Morning again. I just have one item on the agenda tomorrow, a contract with Goodwill. This is our last pass-through contract related to our state funding for developmental disabilities, employment and day programs. Well, this is our last pass-through contract. This contract's up to $87,000 for the year. And then we also, just a reminder too, tomorrow, 10 o'clock, we have our discussion and review of our local homeless housing plan.
All right. Okay,
Questions? Good.
okay, thank you.
Thank you.
I thought I saw Jessica there. We can move into your world.
Good morning, Jessica Warren, Human Resources. The first item I have comes from IT. During the budget workshop, they had made a request for an ERP analyst. This is regarding, a training position for one of their current employees that's retiring next year. They'd like to work on filling this sooner rather than later because it could take some time to fill. So they're requesting to fill that position sooner, so they can get it posted at salary grade 535, which is 64.98 to 82.47 a month.
And it's a position we put in the budget.
Yeah, so it hasn't technically been approved yet for the 2026 budget, so they'd like to get that approved to start looking for that position now.
For that position.
Was it in the 2025 budget?
No, this is
Brand new?
a new overlap type position, so it would be filled, but then not refilled once the current employee leaves.
Oh, I see.
Does that make sense?
We're giving time for training type
Yes.
stuff.
Yeah.
Yeah, I'm good with it.
I'm good with it.
Yeah.
Thank you. And then I have 2 executive sessions, one for performance of a public employee and one for collective bargaining.
Time frame
We'll say 10 minutes or both.
for both? Okay, we're going to executive session for performance of a public employee, collective bargaining, 10 minutes.
The board is extending executive session for a period of 2 minutes until 11:17 a.m.
executive session, no decisions rendered. Jessica, I'll turn it to you.
Okay, I have one more request from Public Services. They're requesting to do a temporary 5% pay increase for the current deputy director due to the additional responsibilities she's taken on. This would be effective November 1st.
Okay,
Good with it.
we're good with it.
Thank you. That's all I have.
Thanks. Okay, we'll head into our workshop with Alliant. I don't know who wants to lead that thing. Keenan? You're the one I know.
Yeah. Oh, I was taking it. That's using that word loosely there, bud.
Do you want me to comment on that or you just?
Feel free.
Nice haircut.
Yeah. You're okay? They're using the two mics? Okay, perfect. Just make sure the bright green light is on. Good.
Perfect. Got it. Appreciate it. Thank you for the opportunity. Nice to meet you. My name is Brian White. I'm with Alliant Insurance Services. Obviously work with Keenan a little further north and have our team here, Ann Shackelford, Kevin Miller, and Austin Smith also with Alliant. I'd say, you know, a difference between Keenan's operating group here more locally and ours is our focus on public sector insurance. So that's kind of why we're the folks in the room with Keenan, of course. And we want to tell you a little bit more, a little bit deeper into the conceptual proposal we've prepared, which I think you've seen before, and we've had an opportunity to kind of add some additional information for your consideration today. And we wanted to thank you and also staff for looking as closely as you are and have been at this this option. We agree it's not something to sort of maybe make a decision in one meeting to decide you want to, you know, leave your current provider and sort of move in a different direction. So the process you're going through is very logical. We would imagine, you know, at least one more meeting with staff and probably a couple more if there's some real traction here to make sure we're sort of launching and on the right foot. We're very confident that you have the right people in the room here to assist the county through this process. And the reason I say that is our company, Alliant, our longtime CEO that transitioned into the chair role just 6 months ago, established our public entity group practice in 1978. So we've been doing this for a long time. I think you'll see in our information that we have a lot of pedigree and qualifications in this space, and it sort of has not come by accident. We've along the way created advantage insurance programs and products that deliver greater value. And I say that while also recognizing at the same time, we're big supporters of insurance pools. We have over 70 insurance pools that are clients across the country. So we understand the way pools operate. We understand what they do, but we're also very solution oriented. So when someone comes to us and says, hey, can you help? Can you help us here? Can you look at what we've got? We're interested in maybe what else might be out there. We're going to, you know, roll up our sleeves and do what we do best, which is, you know, negotiating and placing insurance for our clients with specialty markets using the products and programs we have to come up with what we think are really good solutions. So that's kind of the whys and wherefores of how we sort of got to the room. And then we can sort of walk through, we won't go through all the slides. There's a lot of slides here. We realize you want to get through this in 30 minutes. Hopefully we can get through the presentation in 20, but I do want to invite questions along the way, so we can certainly take that full 30 or longer if you've got those. I mean, that's probably the most important thing in our minds is addressing your questions.
So I have one real quick to your most recent comment. Which pools are you a reinsurer in any pools in the state of Washington right now?
We do, yeah.
Okay.
Not your current pool. Let's see. So I'm going to skip through to slide number 4, as I think it's really important you understand who the team members are. Brian White had been with Alliant for almost 25 years, started when we were 85 million in revenue, and now we're over 5 billion, the most recent year completed. Like a great team, there's more than one of us, and we've got a lot of resources in our group. Ann Shackelford, my colleague here, sort of the co-team leader, is focused on the casualty placement would be for Cowlitz and is involved in structuring and placing that thus far. Kevin Miller on my right-hand side here, property driven, but also has some experience in casualty as well. And then Austin, our newest team member, we're growing, we're a healthy office, is closely involved in all aspects of the programs, including the supplemental lines of insurance as well. So the reason I mention all the different names are that we've got the ability to sub in folks if we need to. We have a deep bench. So, if God forbid something to happen to one of us, we could move on and keep the ball moving pretty easily in our minds. Other important people who aren't in the room that are on this page is our claims staff. Under other resources, Bob Fry, Rachel Wrightson. We understand insurance claims can sometimes be complicated, sometimes don't always go maybe as intended or you thought they should or would. We're there as your advocate along the way. That's a real important part of what we do, because at the end of the day, if our clients don't get value from our insurance, they're no longer our clients. And obviously that's not a good thing for the business model. So that's very much an important element of what we do. Very quickly about Alliant, we are a privately owned insurance broker, but that's not just a lucky few. We're a majority employee owned, and our CEO that I mentioned, Tom Corbett, who recently transitioned to chair, engineered an employee buyout in the late 90s. And ever since then, we've been able to maintain that majority employee owned and create stock ownership opportunities for the employees and liquidity opportunities. And it's been a great story to attract some of the best talent within the industry. And we've grown out our public entity practice into real estate, into marine and energy, into healthcare, all these different segments and verticals across different areas of expertise where, again, we can bring better value to our clients because we do a lot of it.
So when you hire somebody in, they become like a WINCO, they become an owner or the part owner of it?
Yeah, eventually, yeah.
Yeah.
That's the idea.
There's a process for it.
There is a process. There's a certain level, and we do have private capital that we partner with. But I think the most important thing is we've maintained that 51% so that we've got organizational control over the operations.
You may not know this, but do you know what your average tenure is for your employees?
That's an excellent question. Well, I can tell you, I've been here for 25 years. She's been here for 10. Kevin's been here for 18. Austin's our new one. And so it's not unusual to run into employees that have been here for decades. And a lot of the folks, who have been, it's created a rewarding career for a lot. So moving right along, experience with public entities. I'm going to skip over to slide number 7, and this gives you an idea of folks we work with across the country, and then we've bolded, those closer to home that give you an idea of folks we work with. I want to add that there's 5 counties in the state that don't participate in one of the 2 counties pools, and 4 out of those 5 we work with. And again, we believe that's strategic in their decisions to work with us because of the advantage products and experience that we bring to this space. And we've worked with them, many of them for many, many years. Kitsap, for example, over 15 years. Moving along to slide number 8, just more specifically trying to give you a flavor of the folks we work with. Pierce, we work with the Port of Longview, City of Kent, City of Renton, City of Marysville, and a lot of these were previously in one of the pools, by the way. Alrighty, moving along to slide number 11, and of course, stop me along the way if you have any questions. This slide came together because, again, when folks come to us and say, gosh, I'm looking at leaving the pool, what are all the things that we need to think about? And we spent a lot of time thinking about this and created this matrix, as you will, in terms of, major criteria in our mind. You notice price isn't on here, but a non-price comparison points between what would be a pool and then an independent insurance program. We think that the top half, might be the more important aspects of it. And so you talk about claims administration, who's gonna take the claim from the general public if a golf ball hits a window or something worse happens. And in the program we're proposing for the county, you would have a third-party claims administrator, or a TPA for short. So pretty standard in the insurance space. We've spoken to 2 already that have a big footprint in public entities. They'd be happy to work with the county. We have some rough indications from them in terms of what the cost would be. That's built into our proposal. It's a really important element of doing this, making sure that you can handle the claims, you're recording them in a database properly, et cetera. So I think over time, if you were to do this, that's something that your own staff could take on, but it would be something that, you'd want to do in a measured way and make sure they had the experience maybe before, like, running out the gate saying, hey, we're going to do this. We have the capabilities and the experience. So again, another thing that many of our clients have.
What do the other 4 do? How do they handle it?
Oh,
Do they use a third party, or do they, to the size, they do their own?
good question. So they actually do their own. All of them do their own. The other cities that we work with that have previously been part of a pool, some of them have TPAs and some of them do it themselves. Your volume of claims, you have somewhere between 18 to 21 on average over the last 15 years that we looked at. It's not a huge volume. In fact, one of the TPAs we talked to said they can probably do it on a time expense basis, probably be the most cost effective, but we've got a fixed cost option as well. Claims control and settlement, in our view, that actually becomes more control to the county's part when you actually get to say when you pay claims within your retention versus your current structure. It may not sort of feel this way, but I think your current provider sort of decides how the claim's going to get adjusted. I believe that there is input from your folks, but we just want to impart on you that you wouldn't be taking a step back there. In fact, you'd actually have more control within your SIR because you're sort of calling the shots there. We like to think of this as moving out of a pool into an independent insurance program. Is you're sort of going from being a passenger in the car to a little bit of a driver, or at least moving into the front seat with consultants and advisors around you.
Can you go a little bit further into that? Because with the SIRs being set, what control do we actually have?
In terms of choosing your SIR or the actual claim, like if a claim happens and how do you want to settle it?
The claim itself.
Yeah. So through your own staff folks, who's ever responsible for risk and who's, the designated person within the organization to make decisions, a lot of those are going to be pretty straightforward on the smaller claims, right? We imagine that, with the third-party claims administrator, it's it was our golf ball from our municipal course, and I realize you may not have one, but just using that example, we're going to pay the $250, to repair the windshield, right? If it's a more difficult claim, a challenging loss where maybe the facts and circumstances aren't clear, you'll go through, with the help of your TPA, an investigation. You'll engage with legal counsel if you need to. Those will probably be those would be the farther and fewer in between, right? But no different now than you have legal counsel on those tricky ones. And you'd come up with a game plan effectively to manage that loss through to completion. And so you're very much an instrumental part. I say you, it's probably your legal counsel and risk manager, right? In deciding, okay, is this one that we want to defend because we feel like the facts of the case are in our favor? Or is this one where you're looking at this thing and saying, gosh, this doesn't look good. I think there's some liability here do we really want to roll the dice on this one through the legal system, right? Or, maybe it's somewhere in between, but I think that's a strategy that you develop along the way with input from, your legal counsel and also your third-party claims administrator to decide, sort of what you're going to do. And then you, along the way, you have a conversation with your excess insurer if it's that large. Historically, you haven't had a lot of these, by the way. And then we engage with them and we may get advice from them, but a lot of times they actually look to you to control and defend the claim. And then, if they have, anything to add, they may bring that up in the process and we have a conversation with them sort of around the table or on a phone. We've got our claims advocacy group as well. So if there are any, bumps in the road, that's really where we add a lot of our value, is trying to help carriers, if we need to, see things sort of through our point of view, or our client's point of view. Legal defense, you can keep the attorneys you currently use. The cost of those is included in our projections. We'll talk about that more. Or you can choose different attorneys. You don't have to use the same folks that you've always used, but if there's familiarity, great. A lot of times, depending on the loss, if it's very nuanced, there's sort of experts, quote unquote, in that space that you may want to lean on, depending on the specific need. Just a couple things on coverage. We feel like the coverage stacks up really well in terms of what we're quoting. We had heard there was the potential for maybe your current provider to move to a claims made on some certain coverage aspects, which we don't believe benefit you. I think from the insurer's perspective, I think that's beneficial to be on a claims made. From a client's perspective, occurrence-based coverage is really what I would consider more of the gold standard. So the coverage that we're quoting you is on an occurrence basis. And also limits are dedicated entirely to Cowlitz. I think in the rare situation where you had a lot of bad claims, potentially through a pool, oftentimes there's aggregate limits that apply across all the members. So that's not something we would be quoting you for shared limits. These are dedicated limits to yourself.
Could you explain the difference between an occurrence-based and a claims based?
Yeah, good question. So this is going right to like 401 level stuff. So I'll do the best I can here. Occurrence policies, very simply, the policy that responds is the policy that was in force when the claim or the bad thing happened, right? So, the policy expires and it's sort of like, let's just say you're in a boat and you're floating away from it. That policy lives there. Those liabilities live there in that policy. And you can go back 20 years if something gets reported to you and you can place that way back over there, right? So it's off your books. On the claims made policy, you sort of carry that liability forward every year, right? So I would suggest that liability then lives almost with you, the entity, and it's your duty and obligation to report things as they become known to that insurer that you're insured during when that bad thing happened and you found out about it. And that's your mechanism of transferring risk at that point. So there's a much higher standard of care with reporting claims to the insurer under a claims made program. Otherwise, that thing stays with you forever, right?
So there is no statute of limitations on that.
Well, good question. I think that's a legal question. I'll play out house attorney a little bit. So, for something like sexual molestation, in essence, in the state of Washington, there is almost no statute of limitation, right? I think for other things, there are statutes of limitations that apply.
And in my understanding of it, correct me if I'm wrong, please, is that in that claims made, every year you move forward, technically there's more claims getting put in your boat. Correct?
Yeah, and you get what's called a tail. You start getting a tail. So I like that analogy, right? Or a big anchor or something like that. And the anchor's getting longer. And so when you then want to change carriers, it actually makes it really difficult when you have some of your coverages on claims made because your anchor's really long and you got to convince another carrier to take that anchor. That's kind of a tough pitch, right? And usually sometimes not usually. Sometimes your existing provider will take that anchor from you, but in this market that's really difficult, it's really hard. We find that there are very few markets that want to take that anchor and accept it, right? And because, well, with that anchor, you don't have a lot of options, frankly. So.
Can I quick comment too in that this is a common change, the conversion from an occurrence-based form for sexual abuse molestation to claims-made forms throughout the state because of the reviver statutes that now remain quite open, making a lot of public entities quite vulnerable to historical losses that could be voluminous and devastating. So this is, if it's happening in where you are currently structured and placed, that's a very unfortunate common reaction to other structures and other needs for the carriers to take a change to reduce their risk going forward in a way. So we're seeing it on individual risks too, school districts and cities and elsewhere that have this narrowing of cover because of the market that we're in.
So how are you guys mitigating that?
Good question. So we like to think of ourselves as a speedboat. We're in the market every day of the year. I think from a 30,000 foot level, it's sort of like, folks maybe think the insurance broker shows up 30 days before the renewal and then you never see them again. And this is what we do day in, day out. We're renewing these policies with these complicated issues in this challenging tort environment every month, right? So we have our finger on the pulse on which markets are doing what they're doing, new markets entering the space, how to capitalize on that, right? Are there opportunities we can use? How do we balance that with, making sure we got bridges to cross, right? In case, we need to use another insurance company down the road. So it's very much about, being in the space, being active, and also having our clients tell their story, right? I feel like you've got a unique story to tell relative to maybe other counties in the state and giving you a voice, right? With your insurance company sitting at the table with us. We obviously respectful of your time and don't want to ask your staff to join us on every underwriting meeting, but there are opportunities to do that very much in using Zoom and creating, pitch decks effectively to the markets to build comfort so that they really know and appreciate what makes you different and what makes you a better risk, frankly, than maybe others in the state. So. Yeah.
And that's what Brian means by taking you from a passenger into the driver's seat is you're underwritten based off of your own risks and you're not at the behest of other counties that may be performing less well than you. So that's how we're able to present quotes that are, might have stronger occurrence-based coverages and for less money because you're underwritten specifically for Cowlitz and not as a consortium of a bunch of other counties.
So we're paying for our
Yes.
occurrence, our history.
Yeah, Washington State has unfortunately a target on it as what we've heard as a judicial hellhole. That's just how it is. And that's how we're trying to differentiate our insureds by having those underwriter forms, really literally looking at the loss data historically and, thinking ahead on how risks can be taken differently. So in that effort, you are certainly by our side in the storytelling. And that becomes so vital because then you're not stuck in Washington. You have a very unique footprint, just geographically, politically, locally, personally, all the things. But we love to tell that story with you because that list of other clients we work with is examples of that. They have literally gone through some hard times. City of Portland was on fire. Well, no, they weren't on fire. Parts of it were, but the story we told with them got them to where they are now more insurable because of the relationship with their market. So it's a very important step in the process.
All righty. Moving forward, we wanted to drill down more on the service side of things. The ABCs, the fundamentals, the blocking and tackling. We've got a plan, a roadmap that we follow to make sure that we're hitting, the agreed upon milestones and steps that we take year to year for our clients. And we wanted to focus just on a few of those here. We thought it would be important just to highlight that we have agreement from the proposing insurer on the lead, the first layer of coverage to provide a $10,000 annual subsidy. That can be used for any number of loss control efforts on the city's part. We did confirm that it can be used for pre-defense review, like EPL, employment practices liability type stuff. He was happy to be able to provide it for that. He sees the value in that. Also, as an Alliant client, we provide a $10,000 subsidy for our clients to use a firm called Vector Solutions, online training, all kinds of stuff with respects to loss control. And let's see, there's, and I'm happy to run through these all, but I feel very confident in saying that we can provide robust services. And again, with the analogy of sort of being a driver in the car, we can guide you in terms of what we see others doing. And then you get to decide on what is most valuable, like for your needs based on a specific year, not necessarily what's being driven by maybe many others, but more specific needs to yourself. We can look at loss history, we can do a review, analytics, and see where the issues are, and then come up with a plan to attack those, if you will, depending on the service needs or resource needs. Moving ahead, I'm going to forward to slide number 14. I think this is a really
Go back
important.
real quick.
Yeah, sure.
On these subsidies that you're talking about, so everything that you've got there is going to be included in our premium, correct?
Correct.
Do these subsidies go against our SIR?
No, they don't.
So it's above and beyond that.
Correct, yes. Alrighty, so slide number 14, a lot of numbers, a lot of rows. Let's go through this, just sort of very basically. The top line is your excess liability coverage up to 25 million. That's 1.6 million and change. And this is at the $250,000 SIR. We understand maybe the county is more interested in that than maybe moving out to that $500,000 SIR its first year. So we did get that option for you to consider. The next row down is that TPA cost, that $40,000 expense. We did get actually a proposal last week where that number came in actually a bit lower. So we're very confident in that. And then this next one, 340 grand, that is a calculation of the projected cost it would be for the county to have, and that should say a $500,000 SIR in any 1 year. And that includes defense costs and indemnity costs for all those expenses within that $250,000. All right, because you're going to pay out of your pocket up to $250 per occurrence, not claimant. It could be 3 people in a car. It's one car accident. That's one occurrence, even though there might be multiple claimants. So we'll talk about how we got to that number, that 340. So maybe remember that 340 there in just a couple minutes. And then your other lines of coverage, which are all much smaller. Property is probably your next largest, and we're happy to talk more about that. So that's how we get that total of 2.583 million. Scrolling ahead to page 15, 3-year pro forma cost projection. Thought this was really interesting, just sort of looking at, okay, what's the county currently paying? What would an independent insurance program look like? And then let's maybe, let's be thoughtful and realistic about maybe what the years ahead look like. And what I mean by that is there were some assumptions we made when coming up with this cost projection. So we assume that the existing provider, it's going to be a multi-year effort to bring the surplus up to a suitable and sustainable level. So it's not going to be sort of a one and done. And I think this is especially challenging right now because everyone's own internal claims cost is going up. Everyone, even when you're on your own, your cost of insurance will be going up. So they're sort of in the face of this ultra inflationary environment, trying to kind of right size, right? That's going to be a challenge. So for the existing provider, we used a 35% increase on liability. We use that because on their most recent executive committee packet, their actuaries gave 3 options. The low end was 35% and the high end was 55%. So we went with the low end. That may not be all. And then we used 25% each of the following 2 years and then some lower numbers on the other lines. Also that existing provider number, that 2.7 in 2025 and then the 3.4 in 26, so on and so forth, that includes the estimated cost of your $100,000 deductible. So, and the reason I wanted to say that is, in the math for that is actually in this as well on one of the prior pages, is you already have a six-figure deductible. So you're already kind of doing this and having to fund for that. What we're suggesting is, you go a little bit bigger, and we think your losses in the math rationalize that and justify it in terms of being a good business decision. So in any case, back to this, the independent program, we, even better news than last time we met with county staff, we were able to secure a 2-year premium guarantee on the primary layer of your casualty tower. So I think that gives you some stability for the first 2 years on that lead layer of coverage, where they're basically saying, hey, look, we're willing to commit to this for 2 years, right? So we've got that built into here, and then we've estimated 12% on excess layers because as I said, the whole market's going up, and we're preparing our clients for that. So
Brian, real quick on your assumptions for the pool,
yeah,
that's just based on current claims? If I remember correctly, right? There was no assumption based on what percentage of claims are going to increase annually. It was just based on the number of claims currently being processed.
it's a good question. The actuary for the pool would be looking at the pool's entire experience, and I think they're probably focused mostly on legacy claims, and the fact that I think those have developed much more significantly than what they thought they had been previously.
I think one thing I want to mention in regards to the 2-year guarantee that we were able to get agreement to is, if you look at year 3 of the independent program, you'll see that what we project as costs, including increases for the other lines, is still less than, or it's actually very similar to what the county's currently paying right now, and less than what we're projecting for just next year for the county. So the ability to stabilize costs is very prevalent.
Thanks, Kevin. Alrighty, moving along to 16. This gives you an idea of what the structure looks like of a proposed insurance program. As I said before, a 500,000 or 250 retention option. We were able to secure that 2-year premium guarantee on that first $5 million of coverage. That's about half your cost. And then the excess coverage would be a part of what's called our public entity group purchase. It's a risk purchasing group here in Washington that several of our clients participate in. Dedicated limits. There's no risk sharing between the two. There's no sort of allocation of risk or anything. It's just a mechanism to we think more smartly place insurance and leveraging the buying power of our clients in the marketplace. So that $20 million excess of 5 would be in that, what we call that WAPEG program.
For Obsidian's layer at the end of the 2-year period, are they going to look at our experience and then adjust, or is there a set after that 2-year period, it's going to go up 5%, or are they going to do both?
Good question. So, some of that depends on your own claims experience. Some of that depends on exposure growth of the county, right? Did you grow? Did you shrink? Some of that depends on the market, right? What's happening in the overall market. I would say, if you were to ask me now what to use as a budget in 2 years, what I know today, I'd probably use plus 12%, the same amount that we're estimating that the excess above that will go up year to year. Alrighty. So I would like to go to slide number 18. I think this is, we're really in the weeds, and I apologize in advance for that, but we really want you to understand that, the numbers here, how we kind of develop them. And this is how we came up with the estimate of what we'll likely need to set aside to fund that $250,000 SIR in any one year. And we came up with that $340,000 number. That was that number I told you we'd come back to. And the way we did that is we went back 11 years on your loss history. We looked at your incurred losses, so second column from the left, and that was actual paid or incurred losses broken up between indemnity, which are damages, and defense costs. We increase those by 8% every year, like present value, right? We brought it all to present value using 8%, which obviously is much higher than the average inflation over that term. And we calculated what the total was and divided by 11, and there's your 340,000. So those are your trended losses. If we were to just use that 2.6 million, second column on the left, divided by 11, that'd be short because it doesn't contemplate inflation, right? Claims inflation especially has been higher than average inflation. So the next page, just for fun, we did it at your $100,000 deductible. And it's interesting, when you go to the $500,000 SIR level,
Yeah.
yeah,
The annual funding requirement goes up $100,000, but the cost savings on the insurance premiums go down 300,000. So there's an argument for going up to the 500,000 based on how your claims have performed.
And obviously, this isn't exactly what your losses are going to be. This is sort of a best projection. An actuary can't tell you exactly what they're going to be, but they work in the world of probabilities, and so over time, right, multiple years.
Brian, can you talk to, how did you come up with our incurred loss due to the fact that the pool was the one paying for that stuff? How did you come up with these numbers?
Great question. So we actually looked at your loss history that the pool provides and used that as the guide.
So those are pretty close to actual.
Yes, as of when we looked at this, I think they were valued as of May 2025. So some losses ultimately settle for more than they're estimated, some less. So the numbers would look different today. Unless you had some huge erosion in claims, I would not expect the numbers to change much between then and now. And a lot of the rest of the slides are, kind of more property related. We get the sense that maybe there's more concern about the casualty. So we won't focus on that, but there's a lot of analytics that went into the property as well. I will move over to kind of next steps on slide number 26, if we can, please. So we've completed a lot of this, right? The initial feasibility study, what it looks like, kind of talking through, the major differences and comparison points. There are some final steps that we would need to complete on our end, and the county would need to complete on its end. We'd projected to maybe tackle some of this in September, but we're still confident that there's more than enough time to get this done. We can move pretty quickly. We don't need a whole lot from the county to proceed, but there is some authorization that would need to take place that would enable us to work and negotiate with some of those markets in the excess carrier, and then finalize the proposal on the excess, refresh the quotes, come back to you with a final proposal, and then be able to bind the new insurance program and get your claims TPA in place. That's another piece that needs to get done as well.
I'm sorry, what's your name? The lady? Yeah.
Ann Shackelford.
Ann, okay.
Yes.
You said something about when we were talking about the tail. So am I to understand correctly that the longer any county or any entity that is under that claims-based program waits, the more difficult it's going to be to get out of it because you're not going to find an insurer that's going to pick that up or that's not going to be cost effective. Is that what you're saying essentially?
Yes, that's fair. Because that new market hasn't had the opportunity to know what historically things are going to look like until then. So I'd say that you would probably want to move quicker than you would otherwise. But there are ways to transition yourself from an occurrence base to a claims base made base that captures that tail of time for a certain amount of time if you wanted to buy that policy to cover those unknown losses that might come in after the sale has been dragged around essentially. But this circumstance here where you would be potentially signing on with an occurrence-based policy, Obsidian, sitting X of your SIR, would then have the opportunity to just, follow your lead in a way on occurrence-based losses, no matter what they are, for law enforcement, sexual abuse, GL, AL, and so on. So I'd say the efficiency is key to finding the right time to make that decision before it's too late.
So hypothetically, in our situation, we've been in that occurrence base for a year, correct? Was it switched over this last year, I think?
I believe you've been on occurrence for many, many years. I believe currently. What I understand is there's some discussion around maybe some of the coverage within your current provider now changing to claims made.
Oh, yeah, that's okay.
That's what you meant, yeah. Okay.
So in that situation, if it was switched over for, let's say, for a year's time, how long do you have to pay for that supplemental policy before that stuff drops off?
Yeah, it's a good question, right? If you were with the traditional insurer, they would be obligated to actually sell you a tail. I'm not sure that obligation exists with your current provider. So if you can't get that, what do you do, right? The next thing you would do, or usually the first thing and most cost-effective thing you do, is you get the new carrier coming on to pick up the tail. That's the challenge, is it's not a given that a market in today's environment would agree to pick up that tail because they don't really have confidence in terms of what they're getting. So I think that's an inherent challenge. If coverage moves to claims made, what does the realistic option look like to move elsewhere? Certainly, never say never. Maybe the market gets softer at some point down the road, but it would present some challenges, I think.
So in our situation, say we stay with the pool and something like that happens and we don't have a tail, where does that liability fall? If it's above our insurance ladder?
Yeah, I think practically speaking, what happens in those situations, in the worst possible situations, is you may not be able to ever leave because you won't have an opportunity to cover that tail because you would never want to take that tail on by yourself, right? Because that would be the option, you take the tail on by yourself, but I just don't know if that's a feasible option.
And that's part of the reason why I've been kind of a squeaky wheel to some of you. If that claims made form is assessed, at your, in your policies moving forward, then, they could hit you up with the 35 to 50% rate increase every single year to make it next to impossible to leave. That's why you gotta weigh leaving the pool at the earliest opportunity because it's gonna be that much easier to leave.
You may not know this. Based on the numbers that you see here, what would a tail policy for us cost right now?
I'm not sure there's a market out there that's willing to sell that.
Oh, so we may not even be able to get one.
I think that's a fair, either that or you'll be on claims made maybe forever kind of thing. Maybe easier to navigate, keeping your SML on a claims made basis. It can get sort of messy because you'd almost have to do a carve out of that exposure and place it with another insurer. That market's not, I would say, robust, healthy, and aggressive. But it would be a challenge, I'd say. And I'm sorry, I can't give you a number.
Yeah, in exercises we've performed for other risks, thinking of leaving a pool, this in case was a K through 12 school district, large school district, who've done the same concerns, evaluations of how long should the tail be if they can get the tail. And in that effort, we had to ballpark a lot of things, but it was multiple dollars of costs that were going to be the deterrent of leaving the pool, because the pool at that time was still occurrence-based, but for now they've evolved to become claims made based. But that evaluation wasn't overnight, took some time, but the tail piece of it was really kind of one of the deterring factors of why they stay where they are. But if that happens, if they were to secure a tail policy and find themselves on their own, independent of the pool, they had to take a, look in the mirror themselves on their risk-taking philosophy. How confident were they going to be that those older losses were really going to come through in the 2-3 year window of the tail policy that was purchased? So every account is entirely different. You may not have a volume of losses that might become tail concerns in a way, but others do. So those who have those volumes of losses are kind of, to be simple about it, are, narrowing the market availability for loss coverage that you would need from moving from occurrence to claims made for the losses we're talking about here. But again, speculations are that's changing on you. If it's not, then touch wood, it doesn't. So.
But regardless of the size of the losses and the number of the losses, if you have to have that tail at some point, it's going to negate any savings because of the cost of it.
Yeah, it's a material factor.
Yeah.
Another question I had for you. You guys, on the slide where you're showing us the insurance ladder, there was 3 rungs.
Mhm.
Can you just speak to how you guys have 3 rungs and other pools and other carriers are having to add rungs in our insurance ladder?
Oh, so the tower, talking about the tower?
That one right there.
Yeah, so I'm sorry, so the
Well, there's other organizations and other pools and things that have 4, 5, and 6 reinsurers in their tower, and
yeah.
we have 3. Can you
Good,
talk
good,
how you did that?
good question. So the WAPEG placement is made up of multiple carriers inside it. So it would look in many ways similar to how your current program looks through your current provider.
So you just condense that top
Yeah.
rung.
Correct.
Okay.
Yeah.
The marketplace in general for the state of Washington, it's hard to get an insurer to provide more than 5 million of capacity. So stacking those insurance companies is, it's a must at this point. Yeah.
And are all those domestic insurers, or are there any international?
They're all domestic. Yeah.
I know the pool's having a hard time getting domestic insurers, and they're looking at Lloyd's of London and other insurers to fill some of these gaps.
Yeah, not surprising to hear, there's some, there are real challenges in the market. And Lloyd's is a provider that insures many of our clients. They're, some of our clients, want Lloyd's on their program, and a lot of times I'm saying, well, it's good to have them if you need an option, but they will tell you too, they're not inexpensive. So, there's a reason that you sort of end up in Lloyd's, but great market, great secure paper, just not inexpensive. And, there's some nuances to how coverage works that sometimes make Lloyd's a little bit of a challenge.
One of the things I've heard from department heads and other electeds is the services that the pool provides to them. I know you had a page that you touched on it briefly, but can you have you guys done a comparison to the services that the pool provides compared to what you provide? And is that included in our deductible, what that looks like also?
Yeah, great question. And I think it's natural to want to focus on, the new provider and, in the abilities that they have to sustain the program as it currently is. And so our costs are cost inclusive. We feel very confident that they're based on the resources we have, the size of our company, $5 billion in revenue, the number of people we have here in the room to answer the phone when you need something, to provide guidance, whatever that may be. Our abilities and our knowledge in this space, having worked with so many public entities for as long as we have, that we feel very confidently that you're not taking a step back in service provisions from Alliant. In fact, we would fairly argue that you're going to take a step forward. You will have the ability to have your own TPA, that if for some reason
they are not meeting your needs, and I don't expect this will be the case, you can move that TPA, right? So you have the ability to bring in any attorneys that you want. If you're not seeing eye to eye on a specific attorney on a particular case, not a good idea to change midstream, but the next case, you can use any attorney you want that's qualified, right? So you actually have the ability, again, to move in, it's that analogy to move into the driver's seat and really determine what's important to you, and then lean on us as your key consultant and provider in that space to help you supplement the services that are pertinent to your organization.
And we also just want to learn more about what the services really are the top 5, the golden stars that need to be mostly replicated and continued with. Part of our transition process is to start our very important open items calls. And as those develop and we evolve with our relationship, we learn more about really you else you might need, don't have on your list, or you don't really need it at all. So I think as our relationships blossom in a way, we learn what really does stand out as key and important to you. And that means to us as well, of course. We are very busy with a lot of local associations and conferencing and a lot of public risk insurance focused networks. So we hear so many things on the street about what's going on and working well here or there. So it's not just here's your policy and don't call us till you have a claim. It's literally soup to nuts, A to Z, guidance, involvement, security, and care that we bring. And what you need from us is more than just a policy, for sure. There are some key things in here that I know Vector Solutions is a really nice resource for some employees trainings, if that's cyber or if it's driver defensive trainings or however those are solutions that we have as well in a portfolio of loss control webinars and guidance and techniques there. So we will like to learn more about what really is the key pieces that the county wants to replicate, because they're important to you, of course. So
Commissioner Rader, we were provided a list of services that the pool provides, and we mimic the slide on slide 12. We mimic those resources.
That list.
Based off of what was provided.
Well, one thing that I can tell you gives me a little bit of angst, and maybe you can touch on this, is like you said, if you don't like this TPA, you can go get another one if you don't like. I don't know what TPAs are out there. I'm not an expert on what attorneys do what. What role do you guys play in that kind of stuff?
Absolutely. And that's a great question. I'm glad you asked that. So we know the players in this space, whether from loss control, we have our own staff, or outsource service providers that we can refer you to. I like to think of like in the insurance world, and my client said it once and I laughed, but it was true. It was like, we're sort of the EMS of the insurance space, emergency medical provider, and so like, you call us when there's a need, right? And we, as Ann said, we like to do those monthly calls, right? To keep us focused on our tasks. We want to be upfront and identify those potential needs before there are any issues, right? But on the TPA side, there's any number of TPAs that we know and have relationships through our conduits via conferences, other clients, right? We create network forums. We're doing a forum in Seattle in March with a large public entity insurer. We're bringing in speakers on a variety of topics, giving the opportunity for our clients to bring folks to come to that. So we're ultra plugged in to all of these different aspects of your insurance program. And kind of going back to, our nature of doing business, it's an entrepreneurial fashion. Your successes are our successes. And we're looking at this thing as, 5 to 10 to 20 year kind of relationship. So we know we can't give you something and then not provide you the support to make it work for 10 or 20 years, right? So I feel confident in that way, but appreciate it's an excellent question, and the same one I'd be asking if I were in your shoes.
When you show that savings as far as our SIR from 250, 100, 500, is that savings inclusive of the cost for a TPA, or is that taken out of there?
Good question. So the TPA is an additional cost. It's a line item on the projection that you'll see there. So that is its own cost, and it's accounted for in the total. The cost of your actual SIR, those are what's called allocated loss adjusting expenses. So that's really specific damages or indemnity you've paid to a claimant, so dollars to make them whole, And the other major component is defense costs. So that's the cost you've had to pay if you had to bring in an attorney. Your TPA costs don't end up there. That's a separate sort of overhead that's accounted for separately on the proposal.
So that savings is just based on the savings that you show there. That's just based on those claims. It's not all inclusive.
It is all inclusive. I'm sorry,
Okay.
maybe that's, yes, directly. So I would say, go to page
And actually,
14.
we did receive a more formal quote, and what's quoted and included in the savings is $40,000 per TPA, but we have a formal quote that was a little bit less than that. So there is an additional, I mean, it's nominal, but it is included in the total cost savings for the county.
So you see it, the second line right there, it's $40,000 for the TPA. That totals 2.583. And that
What page are
2.58,
you on right now?
page 14. So the second row down.
So what's going to impact that cost is claim volume. So,
Exactly. So when we came up with this number, we looked at actually how many claims on average you've had over the last 10 plus years. It's been between 18 and 21. It's not a lot, right? That's why actually one of the TPAs we talked to is like, they should just do it on a time and expense basis, right? And that's a model we could look at, or just a flat fee. And we got that flat fee, actually, that came in from a separate TPA at 30,000. So if your claims doubled, right? And I don't think there's anything that tell us that that's going to happen, but that is a variable in cost, right? Like if your actual claims count doubled, I'd be surprised if that happened all in 1 year. Maybe it goes up on average, 3 to 5% every year kind of thing, maybe, but it was pretty stable as we look back over the years, the count.
Well, in your trend, what would you say that the percentage, 8%, is that what you guys based it off of?
That's what we based the non-TPA claims cost to be, 8% a year. Yeah. So that makes sense.
Got it. Thank you.
And
Couple things I had. I'm sure you have a board. Can you tell me the makeup of the board?
Board of directors
Yeah, where they come from and
in
their
this
backgrounds, roughly?
This is for the board for Alliant Insurance Services?
Yeah.
Oh, okay. All right. Well, great question. So, Tom Corbett is our chair. He had been our CEO since the early 90s of the company. And he started our public entity practice group in 1978. Is still an important part of our company. And he recently, again, went into the chair role. Our next board member is the present CEO of the company, Greg Zimmer. And Greg Zimmer has been around Alliant for 25 plus years. He was the CFO under Tom Corbett for 25 plus years. More recently, we have Peter Carpenter, who's the Chief Operating Officer. He's been our COO for
10 years.
at least 10 years, all prior brokers, right? This is actually a difference in a lot of large insurance brokers. Sometimes they end up with folks that actually haven't been insurance brokers. That's an interesting environment to work within. So they get like that we're, always in front of the client, trying to solve our clients' needs. And I think that positions us better because we're resource-based, solving client problems for our clients versus, we're not a publicly traded insurance broker. We don't have to think about, shareholders in that way, quarter to quarter. So that is something that we are, I don't know if proud's the right word, but we're thankful for, certainly. We'd like to retain that as long as possible.
Do the membership, or are they the ones that vote these people in? How's it work in your group?
That's a good question. So the Alliant Board of Directors I don't, shareholders, like, I don't have enough shares to vote,
Okay.
on that. And I, as a private company, I don't have a lot of visibility into how the actual board members are selected. I think we do have private equity, private capital, as a part of Alliant, and that we've had that for 20+ years. It's a model that's done really well for us. We haven't really been a fixer-up job. I think you can have two different kind of private equities, a fixer-up job, and then folks that are providing you capital to expand in a responsible way. So we fall into the latter there. I'm sure, between them and senior management sort of decide who sits on the board.
Where I'm going with this is the pool board of directors are commissioners from around the state, and they could have a variety of backgrounds. So I'm trying to understand if the people you use, it's sounding like they're insurance people. They're people in this industry.
Definitely
a fair assessment?
definitely the insurance. Yeah, we're placing the insurance, and maybe that's kind of where your question is going, with A-rated insurance companies that are a lot of the same folks that are actually providing coverage for the pool already.
Okay. And I come from an industry, we got yearly or bi-yearly, you would have the people that insured us or overlooked us come in and they'd look at our operation. And there's always certain ratios they look at. They want to know what our capital is. They want to know what our delinquency is and those type of things. What do they look like? What do they look at when they come to you? And where do you fall within where they want you?
Well, do you want to try to answer?
Well, yeah, some of it for our company would be retention first and foremost. So as an organization that serves clients, how are we retaining them? And so from that perspective, our retention, I think the numbers I saw last month were, I want to say it was like 97% for the last year, which I think any good broker is going to be over 90%, but I think our retention's a little bit higher, and some of it has to do with our targeted solutions that we have for our clients. It certainly helps breed longer relationships. I'm trying to think of some other measurements that we use.
How do they get comfortable that you're solvent?
Oh, that we're solvent?
Yeah.
Yeah.
The pool, they don't report to the insurance commissioner. I get that. They report different, but they're under a letter that they need to build some capital in my world.
Yeah.
What tells us that you're solvent?
I guess I want to clarify that us as the broker, we're not the insurance company, right? So I think that's probably a fundamental difference between the folks you're working with currently, who in essence are like an insurance company. They're a coverage provider. And so they have to meet obligations and rules, right, around having enough surplus, whatever those may be in the state of Washington. Ours, we feel, is a much more simplified process. We go out and solicit insurance on your behalf directly from A-rated insurance companies. So you can go look up what their rating is through AM Best. Some of them choose to be rated through S&P, and it's very transparent. Us as a broker, we can't place insurance unless we get a special exception from our clients with insurers that have a rating lower than A-7. So we're not.
Okay. So you're pretty much the middle guy.
Correct.
Yeah.
Brian, not to take away from what you just said. I understand that the rating system that we have is what we have, but the only insurance company to ever go bankrupt in this country was rated A+ by Standard & Poor's, Moody's, and AM Best, AIG. So I'm not saying I don't put stock in the rating system, but I also am pretty leery about it because that same rating system led to the default of one of the largest insurance carriers in the country. So
It's a fair question, right? And so we wouldn't suggest to you that we can guarantee the financial solvency of, you know, the insurance companies in the industry, right? We have to kind of use the tools that are available to us. And for us, it's not just the AM Best rating, right? It's like, who is the underwriter that we're working with? Who is the management? Are they familiar with the public sector? Are they committed to the public sector? What's their track record? How have they been on claims? What is their philosophy on claims, right? That's really important. What does their coverage look like, right? Do they understand and work with us when we have a coverage issue that comes up that we need to address with our clients? Are they receptive to that conversation, right? So there, I think we have these quantitative factors that like get you to the table if you're an insurance company that we place with on behalf of our clients. And then there's those qualitative factors, right? That are like, do they know the business? Are they committed, right? And then there's also the cost of the coverage itself, right? So
Yeah, that explanation does better for me than just giving me the ratings.
yeah, I just wanted to let you know that there's some guardrails that we just can't place with any kind of insurance company that walks through the door.
Yeah.
And you are bound by insurance. So we're all licensed.
Current insurance commission, that give me any comfort, Eden. They're all dysfunctional up there. So you do have guidelines, you just don't do business with anybody. You have some bullet points you're looking for?
Yeah, the reality in the public entity liability space is, you know, there's 10 markets, there's 10 insurance companies that are actively considering the business, right? It's a small space.
Yeah.
So we're leery too of naive capacity in a way. We don't feel that if some exciting new market has knocked on our door with this incredible rate, we just take it and run with it. We're very critical people and we are very much tenacious negotiators for those who do knock on the door. So we definitely feel that the partnerships that you have with your insureds are equally important as we have with them because they do make changes. Our underwriters moved in other places that we really want to follow because they have taken the time to learn how unique and special public entities are. Then you add Washington State to that list, and that's very unique in its own way too. So we find the partners in those 10 markets hopefully stable, and for sure we'll test them and make sure if things were changing financially for them, you're not surprised by that. You are for sure updated with whatever we're learning at the same time. So the solvency issue should not be a concern in some way out of left field.
Well, and you did say that in that Washington Public Entity Group rung in our tower, those are a lot of the same insurers that the pool uses.
Yeah.
So those are the insurance companies that we're dealing with anyway, already.
Correct.
Yeah. And yeah, the quota sharing of that is very important to that group of insurers for the same reasons.
Yeah. So that brings me to, I asked the question of the pool because they admitted they're under a letter. I don't know what they're under, whatever type of thing you want to call it. And my question to them was, there's two things when I was running multiple branches and you'd have a problem. Is something happening that's unique to that branch or do you have a management problem? So my question to them was, is something unique that you're not prepared for or you have a management problem? And what I'm hearing, you shouldn't, it's hard for me to understand how you would have a unique problem. There could be, but it's your job to try and forecast some of these problems and not get into it. Am I overly critical there or am I expecting too much out of you?
Well, one saying in insurance with insurance companies is there's two ways to go out of business. You can either charge too much or you can charge too little, right? So it's a delicate situation, right? And so if factors come in that you didn't account for, then it can make it difficult. I do feel like in the state of Washington, where things have gone on the litigation side has made it challenging and it hard to forecast for. Typically a pool, you're getting a spread of risk to help in that situation. But you know, I think what we're offering is a spread of risk that includes exposures outside of Washington, right? So you may get a better spread of risk with some of these companies.
Okay. So the one, we're dealing with the Washington State entity, and I get it. It's hard to do business in Washington State. Everybody gets that. And you're telling me that we can have some of these savings because we don't have those risks in other areas of where you operate that help contribute, or I don't know if contribute's the right word, but help with the bottom line so you don't have to pass a lot of that on.
I think that's a good way to look at it.
Right. Because then it becomes, again, your management and your involvement and your guidance through the claim activities that may or may not ever happen. So it's less group think and more Cowlitz think. And so that means there's more risk you're taking or stability you're creating in a way that is maybe to your favor and your preference in the area you live. So.
Well, I'm always okay with, we live by the standards we've set.
Yeah.
I get that, and I can live with that, and I think we should be that way. And what I'm hearing, the only thing we really, all the services, it looks like you've tried to cover for that we would have. Now, we may have to do them a little different, and employees never want to change the way they do things, even if it's dysfunctional. It's just the nature of people. But the one thing that is kind of a point for us is this, you call it the tail policy or whatever that is how that was done. And I'm not quite sure how to deal with that, but.
And I do want to clarify, that's not, as it stands today, is not an issue. That becomes an issue if your current provider transitions some of their coverage to claims made.
Oh, I got you.
And,
Okay.
and
Yeah, so part of, I think some of the issues that you guys are facing is you still don't have, coverage documents for next term. So we're giving projections, between a potential 35% increase and 50% increase, because you don't know exactly what's going to be included in your 2026 to 2027 policy. So that's why a lot of what we're talking about is it on a projection, based on what the pool has said in previous meetings, previous documents, with their executive committee, et cetera. All of that is public, so we were able to do some research on projection that they're going. And so some of what they said is moving to a claims made form, increasing your deductible. I think previously it was 25% increase, but the most recent executive committee meeting was 35 to 50% increase. And so that's kind of how we formulated where we think the pool is going, and what we're trying to avoid is you getting stuck having to purchase a tail if they move that coverage to a claim form.
And some of these other counties have been, you said Pierce has been with you, I think I wrote down 15 years.
Kitsap,
Kitsap?
Yeah.
Been with you for 15 years?
yeah.
I'll
I
just,
noticed that, oh, go ahead, Chair.
well, these things are always difficult, for me. Because and it's not the fact that I'm moving to something else, it's that I really care about what happens in the future. So I don't want to make a decision and 4 years down the road, you guys decide, I'm out of here, we're not dealing with the county anymore, those type of things. So I'm not interested in causing people problems down the road. So the more I understand how long you've been dealing with people is helpful to me.
And that's great. I'm glad, you're focusing and asking that question. Our, Alliant for Public Entities has been doing business in the state since 2000, for public entities. For just business in the state, I mean, by way of the fact that we've got we own a broker in like Biggs and others, we've got a footprint that goes back much further. And many of our clients have been our clients within our public entity group for 25, 35 years. So
Have you ever taken on a public entity that you later dropped by your choice?
That's a good question.
Not this group.
Yeah, not us.
No. No, we know that the relationships can be cyclical because of the RFP nature of public entity procurement plans, but we don't want to wait for RFPs. We could happily support an account without a true process for that. I think in my career, former broker life, there was a school district someone said goodbye to because it just was a lot. And that was 30, 40 years ago, but that was not an Alliant client anyway. But it's pretty rare that we say goodbye. We love what we do. And I think we like to be the solutions that they need from us. And we are proud of what we've done with them too. So, yeah.
And we're laughing because we were just sitting and talking before this, talking about how we can help some of the more difficult local municipalities that have some more hair on it.
Yeah.
How we can craft solutions for them, with some of the EPLI issues that we're seeing, some of our local, municipal issues.
I noticed that of all the counties that you guys have in Washington, we would be the smallest. And even some of these cities have very large budgets. Do you see that being a smaller county there, that we might have a disadvantage? I mean, I don't know how to phrase my question, but it's just interesting that the counties that you guys have are all very large. I don't see any small counties on here like ours on. Why is that?
Yeah, I think it has a legacy to do with the historical provision of insurance for counties, especially smaller ones in the state, right? And maybe that's changing now. But I would also say too, you know, if you know, we still pick up the phone, you know, and we'll be there irregardless of your size. I mean, we're right here talking to you. And this means a lot for us. You know, we're a growing office. These are all real people that'll would be working with you. So, you know, we're thankful for this opportunity, and for us, we don't really look at it as, gosh, they're really small. You know, we can't give them the time that they need. I feel like we have the room on our plate, and we're fully committed. We gotta make sure we don't disappoint Keenan too, because he brought us in.
Where's your office at?
We're located in Seattle. Ann lives in Snohomish, you know, a couple of us are around Seattle. So we're pretty, not too far. And we're down here with Kalama and Longview, the ports of 2 or 3 times a year.
Yeah, that's what I was gonna add to what Brian was saying, is they handle, the municipal team doesn't handle, just counties of certain size. They have the ports, they have, some smaller entities. We've talked about, collaborating on some of our, other local municipalities of smaller size. So yeah, you guys aren't gonna get put on the back burner because of your size, and if you ever feel that way, I'll get a hold.
Well, and
What I like about this is one of the advantages to a pool is sharing that risk amongst participants who have similar claims numbers and amounts. When that number gets to be too disparaging, though, I think that it's no longer a mutual benefit to all parties involved. I think there are more parties that receive more of a benefit at a subsidized rate, if you will, than some of the other participants within that. And what I like about what you're presenting here is that this is just based on us. We're accountable for our own. As Chairman said, we set the code of conduct.
Yeah. And because we support so many pools, we know that exact same value base and how that analysis of what you mean to the pool, loss-wise, premium commitments-wise, assessment-wise, is key. And so in that process of determining if you're ready to leave or to talk about leaving, however you are on the journey, it's fine. It's okay. It's good, because you're, like you said, you have had the benefit of the risk purchase in that way, but maybe not as much as others have. And so if you're ready for that change, this route is what we say to be a quite stable route and more to your favor, more to your standing in a way. And back to the small look at the account, we work on so many different accounts. It's not just size. There's housing authorities. There are economic development arms of cities that have a lot of flavor to what a county is already insuring and caring for. So those clients benefit from the larger clients anyway, or in smalls benefits from the large and vice versa. So there's so much crossover in the public entity marketing and broking relationships we have that I can't almost help myself too many times to say, oh, guess what this guy's doing? Because this over here might benefit you as well. So size doesn't matter to us. We really do think the variety and the nuance of public entity broking is what we do very well in part of that process.
Yeah, I think one of the, and I'm just guessing here, I don't know for sure, but I think one of the issues that the smaller have maybe that they're used to being able to call and get a service that they don't have to provide themselves. And you've tried to cover that in here, although you freely say some of the larger counties take that on themselves because they have the ability to do that. But we would always have that ability to transition if we felt we got there, but you've tried to cover some of that in the premium you gave us.
Yeah, and I think, as we move forward, if the dynamics of the cost change, the economics, right, of doing this have changed, I think. This is not something that probably would have been viable 10 years ago. In fact, I'm sure it wouldn't have, but that's how much the market has changed and also the environment within the state, unfortunately.
Very educational.
Yeah.
Anything else? I don't know whether, I guess we'll get together and figure out what we want to do.
Yeah.
Appreciate your time.
Good stuff. Thank you.
Yeah,
Appreciate it.
Very good presentation.
yeah,
Thank you.
learned a lot. Helped me out quite a bit. Appreciate it.
You're welcome. Thanks.
Yeah. Yeah, you too.
Can't wait. Thanks.